Okay, good afternoon, everyone. Actually, I have a problem in my finger today. I have a cut in my index finger. This is a cut. So that's why I can narrate the notes because it will heal. It will take almost 3 or 4 days to get healed. So I have already notes which I sent to the meets. So we can narrate the notes, we can revise the notes. So no need to write down the notes, just revise with me. We will see the notes because today is the last class. I cannot postpone it for 3 or 4 days. Okay. So if I अगर मैं इसको postpone करूं तो like आज today is what today is 16th. मेरे को लगता है ये एकदम कट लगा हुआ है, बिल्कुल पूरा कट है. तो इसमें almost it will take 3 or 4 days to get healed. तो आपका ऐसे ही postponed हो जाएगा, उससे कोई मतलब नहीं है. So once we finish it, that will be fine because notes are the same which I have written. मैंने सारे notes लिखे हुए हैं. I will summarize this, narrate this, and you just revise this. No need to write down the notes. I will send you the notes. Don't worry. Okay. Okay, dear. So now the next topic is decomposition. Don't write down the notes. Please don't write down the notes. Just revise with me. Decomposition. Decomposition word is used for external changes. It means if you are getting external changes, that is known as decomposition. And putrefaction word is used for internal decomposition. Putrefaction word is used for internal decomposition. So that there are two words. Decomposition word is used for external and putrefaction for internal. कौन है? Okay. Okay, no issue. So decomposition word is, please don't write down the notes, just revise the notes. शर्मा गए, कौन शर्मा गए? Okay, कोई दिक्कत नहीं. Decomposition word we use for external changes, putrefaction word we use for internal changes. दोनों का मतलब हिंदी में सड़ना होता है. Decomposition is the surest sign of death. It means, sir, if you have decomposition, that means it is the surest sign of death. Most common bacteria for decomposition is Clostridium welchi. This question comes in exam, my dear friend. Most common bacteria is Clostridium welchi. Most common bacteria is Clostridium welchi. This is a very important MCQ. Which is the commonest bacteria causing decomposition? The answer is Clostridium welchi. Clostridium welchi. Now, sir, most common enzyme. This is a very important MCQ. Most common enzyme is lecithinase. But I will let you know, lecithinase is a lytic enzyme. Lytic means it will cause lysis. So decomposition word is used for external. Putrefaction word is used for internal changes. It is the surest sign of death. It is the surest sign of death. Most common bacteria is Clostridium welchi. Most common enzyme is lecithinase. Lecithinase is a lytic enzyme. ये क्या करेगा? Body का lysis करेगा. It will lyse your body. Now, first external change of the decomposition. This is a very important MCQ, my dear friend. First external change of decomposition. This is greenish discoloration of right iliac fossa. This is greenish discoloration of right iliac fossa. Now, sir, two question comes in exam. Why it is green? Sir, it is green because of sulfa hemoglobin. It is green because of sulfa hemoglobin. And Dr. this sulfa hemoglobin, this greenish discoloration take place in 12 to 18 hours. This greenish discoloration take place. But sir, this question comes, it is greenish discoloration of right iliac fossa. Right iliac fossa. First internal change, this question also comes in exam. First internal change is brownish discoloration of blood vessels. First internal change is brownish discoloration of blood vessels. Okay, तो मेरे साथ रिवाइज करना सर. I just want to get your revision also. Which is the most common bacteria, my dear friend, in decomposition? Most common bacteria? Clostridium welchi. Very good. सारे लोग लिखते रहो, अच्छा रहेगा. Clostridium welchi. Which is the most common enzymatic activity? Which is most common enzymatic activity? Lecithinase. Lecithinase is a lytic enzyme. It will lyse your body. Which is the first external change of the decomposition? First external change of the decomposition? Yes. Greenish discoloration of which area? This question comes. greenish discoloration of right iliac fossa. Greenish discoloration of right iliac fossa. Right iliac fossa. The first is this. First, first internal change is brownish discoloration of blood vessels. This is first change. Now come to the second change, my dear friend. Second change of decomposition is marbling. Second change of decomposition is marbling. Now this question comes, sir, what is marbling? Marbling is seen in chest area. What is marbling? Your superficial vein in chest area become prominent. Your superficial vein of the chest area become prominent. And Dr. Saab, this is also because of sulfa hemoglobin. This is also because of sulfa hemoglobin. And Dr. Saab, this marbling is seen in 36 hours. This marbling is seen in 36 hours. I will show you the picture because this picture also comes in exam. Sir, how this marbling look like? Yes, as I told you, it is superficial vein are prominent on some area. This is known as marbling. This is a picture of marbling. You will see this. See, this is marbling. Now you can see after death, this marbling is seen. This is superficial vein become prominent. It is seen after 36 hours of death. 36 hours of death. Okay, this is known as marbling. Okay, now we are coming to the next part. Very, very important one. See, this is second change. तो डॉक्टर साहब मेरे साथ रिवाइज करना. Which is the first external change of the decomposition? Which is the first external change of the decomposition? Write down. Hilarabad. Which is the first external change of the decomposition? Greenish discoloration of right iliac fossa. Which is the first internal change of the decomposition? First internal change of the decomposition. लिखो brownish discoloration of blood vessels. Marbling is seen after what time? Marbling is seen after what time of death? 36 hours. What is the reason of marbling? Which hemoglobin is a reason of marbling? Which hemoglobin is a reason of marbling? Sulfa and meth hemoglobin or sulfa hemoglobin, both are correct. Now, sir, third change of the decomposition. Now, what will happen? Fly will come on your body. This fly will lay larva and pupa. The fly will lay larva and pupa. This larva and pupa are known as maggots. This larva and pupa are known as maggots. So you will find maggots on the dead body. You will find maggots on the dead body. What will happen? Fly will come, fly will lay eggs. These larvae and pupa are known as maggots. Sir, maggots are seen after 48 hours of death. That is 2 to 3 days. Maggots are seen 48 hours of the death, 2 to 3 days. In rainy season, maggots come earlier. In rainy season, maggots come earlier, that is 1 to 2 days. And study of maggots is known as entomology. Study of maggots, this branch is known as entomology. I will show you the picture because this picture also comes in exam. This picture also comes in exam. So this is maggot. You will see larva and pupa on the body. Yes, larva and pupa of the body. This study is known as study of maggots. And as I told you, maggots are seen after 48 hours. Maggots are seen after 48 hours. Anyway, sir, today I am dictating the notes. Sir, I have some injury on my finger, तो मेरे swelling है थोड़ी सी, but still I'm dictating and I'm revising everything. Okay. So study of maggots is known as entomology. This question comes in exam. After 48 hours, you will see the maggots. Now, fourth change. Sir, after 3 to 4 days, whole body is green and distended. After 3 to 4 days, whole body. Don't write down the notes. Just revise the notes with me. मेरे साथ बोलते जाओ. मैं जो पूछता हूँ वो लिखते जाओ. Body become green and distended. And Dr. Saab, because body has gas formation, the vomiting and frothing comes out from your nose and mouth. This phenomena is known as postmortem purge. Dr. Saab, sometimes you get a question. Postmortem purge is vomiting and frothing from your mouth and nose. This is seen after 3 to 4 days. After 3 to 4 days, your hair become loose and your teeth become loose. These all question comes in exam. After 3 to 4 days, your hair become loose and your teeth become loose. Your teeth become loose. This phenomena is known as postmortem purge. Again, I'm revising, my dear friend. This is very important. Fourth change is after 3 to 4 days. After 3 to 4 days, wait, ऊपर जा रहा है. After 3 to 4 days, whole body become green and distended. Yes, this one. Because of gas formation, vomiting and frothing comes out from the mouth. This is known as postmortem purge. Hair become loose and teeth become loose. Hair become loose and teeth become loose. This is the change which is seen in after 3 to 4 days. 3 to 4 days. Now, sir, I am coming to after 5 to 10 days. This is a very important MCQ. After 5 to 10 days, what happens? After 5 to 10 days, see, after 5 to 10 days, we have colliquative necrosis. After 5 to 10 days, we have colliquative necrosis. Colliquative necrosis. Now, मेरे साथ थोड़ा रिवाइज कर लेना सर. Maggot formation seen after how many days, my dear friend? Maggot formation after how many hours? How many days? Write down. 48 hours. Maggot की स्टडी को क्या बोलते हैं? Study of maggot is known as what? Study of maggot is known as what? Entomology. Study of maggot is known as entomology. In rainy season, maggots come in how many days? In rainy season, maggot come in how many days? 1 to 2 days. Okay. What is the reason of marbling? Which hemoglobin is the reason of marbling? Sulfa hemoglobin is the reason of marbling. Yes, sulfa hemoglobin is the reason of marbling. So this is a very, very important part. What is the hemoglobin which is causing marbling? The answer is sulfa hemoglobin. Okay, done. Now, sir, because now tell me anyone, decomposition is an external change. Internal change is known as what? Decomposition or putrefaction? Internal change is known as what? Decomposition or putrefaction? Okay, it is putrefaction. Now I'll discuss putrefaction. Sir, in putrefaction, this question comes in exam. In putrefaction, the first organ to be putrefied is larynx and trachea. First organ to be putrefied in larynx and trachea. Why? So the reason is simple. Larynx and trachea are in contact with air. Larynx and trachea are in contact with air. After larynx and trachea, what is putrefied? That is liver. Liver is putrefied. And Dr. If you see the liver, liver shows gas formation. Liver shows gas formation. This is known as foamy liver. This is known as foamy liver or honeycomb liver. This is known as foamy liver and honeycomb liver. So, Dr. you can get a question. Which is the first organ to be decomposed? The answer is larynx and trachea. Which is the first organ to be decomposed? The answer is larynx and trachea. After larynx and trachea, liver is decomposed. In gas formation is seen. This is known as honeycomb liver or foamy liver. After that, what decomposes, my dear friend? BHU. The very simple trick is BHU. First brain decomposes, then heart decomposes, and in female, last organ to be decomposed is uterus. This is a very, very important MCQ, my dear friend. In female, last organ to be decomposed is uterus. It is non-gravid uterus. It is non-gravid uterus. Same thing is in male. Same thing is in male. Now, sir, what is the same thing in male? Yes, brain, heart, but Dr. Saab, there is no uterus in male. Last organ to be decomposed in male is prostate gland. So, Dr. you can get two questions. Which is the last structure to be decomposed in female? The answer is uterus. And which is the last structure to be decomposed in male? The answer is prostate gland. Prostate gland. That is a very, very important part, prostate gland. But sir, these are soft organ. What about overall last organ? Sir, overall last organ is bone. Overall last organ is bone. You can see this is overall last organ to be decomposed. Now, rapid revision थोड़ा देखता हूँ आप क्या करते हो. Which is the first organ to be decomposed? Which is the first organ to be decomposed? Larynx and trachea. Honeycomb pattern is seen in which organ? Honeycomb pattern is seen in which organ? Honeycomb pattern is seen in which organ? Liver. Which is the last organ to be decomposed in female? Which is the last organ to be decomposed in female? What is the answer? Yes, Non-gravid uterus. Very good. Non-gravid uterus. Which is the last non-gravid uterus? Which is the last organ in male? Which is the last organ to be decomposed in male? Yes, prostate. But which is the overall last structure to be decomposed? Overall last structure to be decomposed? Bone. All will have different answer. Now, sir, we are coming to Casper dictum. What is Casper dictum? This is a very important word, sir. Casper dictum. Casper dictum is rate of decomposition of dead body. DB is dead body, I already told you. Rate of decomposition of dead body in air, in water, and in soil. Dr. Saab, maximum rate of decomposition. This question comes in exam. Maximum rate of decomposition is in air, then in water, then in soil. Actually, what is the reason behind this? Very simple reason. Air has the maximum number of bacteria. After that, water. After that, soil. It means, sir, maximum rate of decomposition is in air. Maximum rate of decomposition in air, then water, then soil. This relation is known as Casper dictum. Dr. Saab, I'm giving example. If air take 1 week to get body decomposed, water will take 2 weeks, and soil will take 8 weeks. It means minimum time is taken in air. What is the reason? Because maximum rate of decomposition is in air. This relation is known as Casper dictum. This relation is known as Casper dictum. Anyways, आप एक ही लाइन में जवाब देना. Just give me the answer in rapid division. Casper dictum denotes what? Rate of what? Rate of what? Decomposition. And tell me, rate of decomposition is fastest in air, water, or soil? Air, water, or soil? Sir, this is air. And Dr. Saab, this formula was given by Taylor. This is a PG question. This formula was given by Taylor. This is known as Casper dictum. Now I am coming to, sir, mummification. What is mummification? It is a type of decomposition. This question comes. What is mummification? Sir, it is seen when body is in dry and hot climate. When body is in dry and hot climate. How to remember, sir? D for dry and hot climate. This is known as D for desiccation. This body is dehydrated, and Dr. Saab, this question comes. This mummified body is odorless, no smell. Dry and hot climate, desiccation it is known as. Body is dehydrated. What will happen, sir? Body is dehydrated. Water content of the body will be evaporated, coming out, and body will be shrinked, my dear friend. And mummification take 3 months to 1 year. So first write down, first question for you. Mummification is seen in which climate? Anyone? Mummification is seen in which climate? Dry and hot climate. Example is desert area. Desert area. Mummification is also known as, anyone? Mummification is also known as desiccation. Mummified body gives which kind of smell? Mummified body gives which kind of smell? Anyone? Which kind of smell? Odorless. Body is converted in a shrunken mass, shrinked. Now, sir, body is shrink. Now, question. Next question for you. What is the time required for a whole body to get mummified? What is the time required for a whole body to get mummified? 3 months to 1 year. 3 months to 1 year. 3 months to 1 year. Now, sir, write down. Okay, this is very important. 3 months to 1 year. Done. Now, sir, a very important MCQ comes. Natural feature of the body are preserved. Bones are preserved. There is no loss of the bone. There is no loss of the natural feature. These are preserved. So what are the advantages of mummification? First, it gives idea about climate. First, it gives idea about climate. Second, it gives idea about time since death. Second, it gives idea about time since death. Third, sir, because natural features are preserved. Because natural features are preserved, you can identify person for a longer period. You can identify person for longer period. You can identify person for longer period. So this is known as mummification. If there is any image of mummification is there, I will let you know. I don't think like there is an image of mummified body. Let me see an image. I've shown you most of the images. Actually, sir, this is a mummified fetus. This is not a normal fetus. It is a sign of intrauterine death. This is a mummified fetus. This is a different image. This is a mummified fetus. Anyways, I will explain this also. That is a different thing. This is known as mummified fetus. Anyways, sir, मेरे साथ थोड़ा रिवाइज करना. First question. First question. Which climate favors mummification?
सर कोई इमेज नहीं दिख रहा था.
कोई बात नहीं. Which climate favors mummification? अब दिख रहा है? Now you can see.
Yes, sir.
Okay, this is a mummified fetus. This is a shrunken mass, which is a sign of intrauterine death. This is known as mummified fetus. Mummified fetus. चलो मेरे साथ रिवाइज करो. Which climate shows mummification? Which climate shows mummification? First question. बोलो, बोलते जाओ.
Hot and dry.
Dry and hot. Okay. Second question. Which smell of mummified body is seen? What is the smell of mummified body? What is the smell of mummified body? No smell, odorless. What is the time required to body get mummified? 3 months to 1 year. Dr. Saab, mummification is also known as, what is another name of mummification? Yes, anyone? Sir, it is desiccation. Mummification is also known as desiccation. Absolutely right. Now I am coming to the next decomposition chain, sir, adipocere. Sir, mummification is seen in dry and hot climate. जो एकदम गर्मा गर्म माहौल हो. Adipocere is seen in warm and humid climate. Adipocere is known as warm and humid climate. It is seen. It is also known as saponification. And another name of adipocere is grave wax. Another name of adipocere is grave wax. Grave wax. एक तरह से मोम बन जाता है. Now, sir, what happens, sir? Here, bacteria is Clostridium velchi. Here, in warm and humid environment, bacteria is Clostridium velchi. This bacteria liberates lipase enzyme. This bacteria liberates lipase enzyme. What this bacteria do? Sir, there are certain fatty part in our body. There are certain fatty part in our body, especially skin of buttocks, abdomen, and breast. Buttock, abdomen, and breast. What will happen, sir? The skin of the buttock, abdomen, breast, in the presence of Clostridium velchi and in the lipase enzyme, this will form adipocere. This will form adipocere. This will form adipocere. Dr. Saab, what adipocere look like? It is a white, greasy, and translucent. It is white, greasy, and translucent, and look like rancid butter smell. And when it becomes old, it becomes yellow and dry. When it becomes old, it becomes yellow and dry. Now this question comes, what is the time required for adipocere? The time required is 3 weeks to 3 months. What is the time required for adipocere? इंटरनल चेंज तो सर डीकम्पोजिशन में भी बोल रहा हूं, तो पुट्रीफैक्शन में, अरे decomposition and putrefaction both are same. Decomposition word is used for external change and putrefaction word we use for internal change. Okay, chalo, what is the time required for adipocere? 3 weeks to 3 months. Adipocere when become old, it becomes yellow and dry. Adipocere when become old, then it becomes yellow and dry. Fetus below 7 months of age. Fetus below 7 months of age, adipocere is small, absent. Adipocere is absent. What is the advantage of adipocere? Same advantage like mummification. Sir, it gives idea about climate. It gives idea about time since death, and identification is easy. Now, Dr. Saab, you can write down one more word. Adipocere gives ammonical smell. Adipocere is giving ammonical smell. देखो सर, क्वेश्चन क्या क्या बन सकते हैं? Listen, warm and humid climate में होता है. What is the smell given? It is rancid butter or ammonical smell. It is also known as saponification or grave wax. It is a change of the fatty part of the skin, first, buttock, abdomen, and breast. Bacteria is same Clostridium velchi, but enzyme is lipase. Your skin become white, greasy, and translucent. After certain time, it becomes yellow and dry. Yellow and dry. It is fetus below 7 months of age. It is absent. It gives idea about climate, time since death, and identification is important. Now, जो क्वेश्चन बनते हैं मैं एक बार फिर पूछ लेता हूं आपको. What is the smell of adipose hair? What is the smell of adipose hair? Ammonical. Rancid butter, ammonical, both are right. Okay. Which enzyme is useful for making adipose hair? Which enzyme is useful for making adipose hair? Lipase. Lipase. Very good. Which bacteria is useful for adipose hair? Bacteria. Clostridium welchi. Very good. What is the climate for adipose hair required? Dry and hot or warm and humid? Warm and humid. Which two words are used for adipose hair? Two synonymous of adipose hair. Number one, saponification. Number two, grave wax. Okay. Fetus below what age is it? It is absent. Fetus below what age it is absent? Yes, sir. Answer will be yes. Below 7 months. Fetus below 7 months, it will be absent. It will be absent in fetus below 7 months of age. Now, sir, next important word, body to preserve. For body to be preserved, we use a fluid. For body to be preserved, we use a fluid. This fluid is known as embalming fluid. This fluid is known as embalming fluid. For body to be preserved, we use a fluid that is known as embalming fluid. Dr. Embalming fluid is injected in femoral artery. Embalming fluid is injected in femoral artery. Now, what is the composition of embalming fluid? This question comes. First is formaldehyde. Second is methanol. Third is phenol. Fourth is glycerin. Fifth is sodium chloride. Sixth is sodium citrate. Seventh is water. Again, I'm revising, my dear friend. Again, I'm revising formaldehyde, methanol, phenol, formaldehyde, methanol, phenol, glycerin, sodium chloride, sodium citrate, and water. Dr. Saab, these are the main elements of embalming fluid. These are injected in your body after death, so body can be preserved for a longer period. Body can be preserved for a longer period. This question comes, which arteries used for embalming fluid injection? The best artery is femoral artery. Now, sir, first we conduct postmortem, then we do embalming. Because if we do embalming before the postmortem, the cause of death can be hampered. Doctor, this question comes. If embalming is done before postmortem, if embalming is done before postmortem, sir, it means doctor is destroying the evidence. And I told you already, destroy the evidence comes under 201 IPC. Destruction of evidence comes under 201 IPC. Yes, Damodaran, absolutely right. You are absolutely right. Destruction of evidence comes under. So embalming should always be done. Yes, sir. Embalming should always be done. Yes, friends, after postmortem. If you do before postmortem, this doctor will be punishable under 201 IPC. Now, sir, this is another very important MCQ. If you have a non-dead body, if you have DB's dead body, a non-dead body, minimum time of preservation for a non-dead body means, sir, this time is must to preserve the dead body. That is 72 hours. Minimum time to preserve the unknown dead body. It means the minimum time to preserve that we require is 72 hours. 72 hours. 72 hours. Now, Dr. Saab, another very important word comes. If any, Dr. Saab, ये question आता है कि what is the minimum time required to preserve the dead body? The answer will be 72 hours. अगर unknown dead body है, आपको minimum 72 hours, because 72 hours if the police investigate, police identify the dead body, relative identify the dead body, then it's okay. Otherwise, minimum time for preservation is 72 hours. If any person dies due to starvation, if any person dies due to starvation, the most characteristic finding, if any person dies due to starvation, most characteristic finding, postmortem finding I'm talking about, It is gallbladder distension. It is gallbladder distension. Gallbladder distension. चलो मैं आपसे कुछ MCQ पूछता हूँ. What is the best route for embalming fluid? What is the best route of embalming fluid? Femoral artery. If embalming done before postmortem, doctor is punishable under which IPC? Which IPC? 201 IPC. 201 IPC. Embalming is generally used to preserve dead body. Minimum time for preservation for unknown dead body. Minimum time for preservation of unknown dead body. Yes, answer is 72 hours. If any person dies due to starvation, starvation मतलब भूखमरी. If any person dies due to starvation, what is the most characteristic finding? What is the most characteristic finding? Gallbladder distension. That is very, very important, my dear. Very, very important. Now, sir, I am coming to the next important word. Sir, in this slide, what you will see, in this slide, what you will see, what is defined in which place? In this slide, what you will see, what is defined in which place? See, very important MCQ comes in exam. Oath is defined, I have already told you, in Geneva, Declaration of Geneva. Declaration of Geneva. Now, sir, death. Sir, D for death, it is defined under D for Sydney, D. T for torture, yes. T for Tokyo. And torture patient are also examined in Istanbul. Torture. Abortion. Dr. Saab, therapeutic abortion has 2O. Therapeutic abortion has 2O. It is defined in Declaration of Oslo, again 2O. Medicine. M for medicine, it is defined in M for Munich. H for human experimentation, it is defined, Dr. Saab, everything with trick. Everything is trick. देखो याद कैसे करोगे? Oath, Dr. Saab, oath is genuine. Genuine means Geneva. Oath is always genuine. जो genuine आदमी oath लेते हैं, that is Geneva. D for death, D for Sydney में death की definition, Declaration of Sydney. T for torture, T for Tokyo, it was also in Istanbul. Abortion has 2O, it was defined in 2O Oslo. Medicine in Munich, human experimentation in Helsinki. Now, if you want to remember one more, definition of terminal illness. Definition of terminal illness. Terminal illness. A terminal illness. It was defined in Venice. See, how to remember Venice? Venice is illness is illness. Illness को आप short में बोल सकते हो. Illness को is Venice. It was defined in Venice. Terminal illness was defined in Venice. Terminal illness was defined in Venice. चलो मेरे साथ रिवाइज करो. Human experimentation, declaration of human experimentation, declaration of बोलो जल्दी. Declaration of, yes, let me see your answer. Medicine, mic mute करो करम जल्लो. Medicine, Munich. Torture, Tokyo and Istanbul. Oath, declaration of Geneva. Therapeutic abortion, abortion, Oslo. Very good. Terminal illness, Venice. Very good, my dear friend. Very good, Dr. Saab, very good. Now I am coming to very, very important topic, my dear friend. That is.
सर एक मिनट मैं थोड़ा चला गया था सर. वो ये सब है क्या, मतलब ये ओथ वगैरह?
These are the definition given in these places. Okay, definition given in these places. Okay. Infanticide. What is infanticide, friends? Infanticide is killing a child below 1 year of age. Killing a child below 1 year of age. This is known as infanticide. Neonaticide is killing a child below 24 hours. Killing a child below 24 hours. What is filicide? If child is killed by parents. If child is killed by parents, this is known as filicide. child is killed by parents, it is known as filicide. Filicide. Now, sir, I am coming to very, very important word. What is this? Sir, what is the age of viability? What is the age of viability for fetus? After 28 weeks, means 7 months, fetus become viable. After 28 weeks of the fetus become viable. What is the meaning of viable? Means after 28 weeks, fetus is capable of survival outside. After 28 weeks, fetus is capable of survival outside. चलो मेरे साथ word use बोलो. What is the age of viability, my dear friend, for fetus? 28 weeks. 28 weeks. When child is killed by parents, which word is used? Filicide. Neonaticide is killing a child below what age? Below what age? Yes, 24 hours. Very good. 24 hours. Done. Now, sir, after 28 weeks, fetus is viable. If before 28 weeks, below 28 weeks, fetus comes out, it is non-viable fetus, and this is known as abortion. Below 28 weeks, if the fetus comes out, it is known as non-viable fetus. This condition is known as abortion. But sir, if fetus is more than 28 weeks, if fetus is more than 28 weeks and then fetus dies, what we use three terms. What are the terms which we use for fetus more than 28 weeks and the fetus dies? If fetus dies inside uterus, if fetus dies inside uterus, it is known as intrauterine death and dead bone. It is known as intrauterine death if the fetus dies inside uterus after 28 weeks. If fetus dies in birth canal, this is very important. This is known as stillborn. And if fetus after coming out respired, respiration present at least once, this is known as live born. Again, I am revising, my dear friend. After 28 weeks, fetus are of three types. After 28 weeks, fetus are of three types. First, if the fetus dies inside the uterus, it is known as intrauterine death or dead bone. If the fetus dies in birth canal, it is known as stillborn. It is known as stillborn. And if the fetus after coming out respired at least once, it is known as live born. It is known as live born. Live born. So after 28 weeks, because fetus is viable, we can see few sign of maybe inside the uterus dead bone, in birth canal if dies stillborn, or if respiration is present, it is live born. Now sir, what are the feature of dead bone? तो मेरे साथ रिवाइज करना सर. After 28 weeks, if the fetus respired at least once after coming out, known as live bone. Dies inside the uterus, known as yes, dead bone. Dies in birth canal, known as stillborn. Very good, my dear friend. It's very simple. Now sir, what are the finding of dead bone? What are the finding of dead bone? I just made a very simple trick. RAM, RAMS. These are four findings. Sir, R4, the first finding is Robert's sign is present. Robert's sign is a radiological sign, my dear friend. What is Robert's sign? Gas present in aorta. That is the earliest sign of the dead bone. That is the earliest sign of the dead bone, gas present in aorta. R for arm, rigor mortis also present. R for arm, rigor mortis also present. So, Dr. Saab, first is R for Robert's sign, R for arm, rigor mortis present. Now, Dr. Saab, everyone knows fetus is surrounded by amniotic fluid. When amniotic fluid is more, fetus dies, there is a aseptic autolysis. And Dr. Saab, this aseptic autolysis, skin is peeled off. This aseptic autolysis, skin is peeled off. This finding is known as maceration. I will show you the picture. When skin is peeled off, this finding is known as maceration. Maceration is the most important sign of dead bone. If amniotic fluid is less, amniotic fluid is more, there is a maceration. If amniotic fluid is less, fetus is converted in a shrunken mass. This is known as mummification. This is known as mummification. It is shrunk fetus. And Oxab, as for Spalding sign, overlapping of the cranial bones. As for Spalding sign, overlapping of the cranial bones. Sir, I am revising all the sign again. Wait. RAMS, R-A-M-S, these are the sign of dead bone. These suggest that the fetus died inside the uterus. R for Roberts sign, air in aorta, radiological sign, earliest sign. A for aseptic autolysis, surrounding by amniotic fluid, fetus will be, skin will be peeled off. This is known as maceration. This is the most important sign. M for mummification. If amniotic fluid is less, fetus is converted in a shrunken mass, mummification. And overlapping of the cranial bone is a Spalding sign. Dr. Saab, Roberts sign and Spalding sign are radiological sign. Roberts sign and Spalding sign are radiological sign. तो मेरे साथ रिवाइज करना थोड़ा सा. Overlapping of the cranial bone is known as which sign, my dear friend? Overlapping of the cranial bone is known as which sign? Yes, Spalding sign. Gas in aorta is known as which sign? Gas in aorta is known as which sign? Yes, friend. Gas in aorta is known as Roberts sign. Which is the earliest sign of the dead bone? Earliest sign of the dead bone? Yes, friends. Earliest sign of dead bone is Roberts sign. Which is the most important sign of the dead bone? Most important sign of the dead bone? Maceration. As I told you, you can see the image. This is maceration. As I told you, maceration is aseptic autolysis. And fetus is surrounded by amniotic fluid. You can see the skin is peeled off. This finding, where skin is peeled off, the blister on the skin, this finding is known as maceration. This is known as most important finding of dead bone. This is known as most important finding of the dead bone. I already told you this finding. Yes, yes, this finding I have already told you. This is mummification. What is mummification? If amniotic fluid is less, if amniotic fluid is less, fetus is converted in a shrunken mass. This condition is known as mummified fetus. This condition is known as mummified fetus. Anyway, sir, these are the finding of dead bone. These are the finding of dead bone. Now I am coming to, sir, live bone. Live bone. Sir, live bone means there will be sign of respiration. Sign of respiration will be present. There will be sign of respiration. Lungs are inflated. Lungs are inflated. So, Dr. Saab, if you have sign of respiration and lungs are inflated, that is a finding of live bone. If lungs are inflated, sign of respiration, air entry in your lung will be present. Air entry in your lung will be present. Air entry in your lung will be present. Now, Dr. Saab, if lungs are inflated, diaphragm will go low. If lungs are inflated, diaphragm will go low. Lower position of the diaphragm. Yes. Lower position of the diaphragm. Yes. So, Dr. Saab, if you see, diaphragm will go low. And this diaphragm goes to the, this diaphragm goes to the 6th to 7th ribs. 6th to 7th ribs. Wait. वेट वापस क्लिक करता हूं इसको. लाइव बोन, बता रहा हूँ डॉक्टर साहब, बता रहा हूँ, ये वेट करो, मेरा थोड़ा सा लिखा नहीं जा रहा इस पे, क्या प्रॉब्लम हुई है, ये देखना पड़ेगा ना। लाइव बोन का मतलब the fetus who has respired after coming out, that is known as live bone. That is respiration is present. Respiration is present. That is live bone. So lung will have, yes, okay, done. So lungs are inflated. Okay, lungs are inflated. Diaphragm will be at lower position. This diaphragm position will be 6 to 7 ribs. So because lungs are inflated, diaphragm. So what is the live bone? Where respiration has taken place. Any fetus where respiration has taken place after coming out, that is a live bone. Respiration is present, that means air entry is present. Respiration is present, that means air entry is present. Lungs are inflated. Lungs are inflated. Yes. Diaphragm goes to the lower position, that is 6 to 7 ribs. चलो मैं थोड़ा सा आपका रिवाइज कर देता हूं. दो क्वेश्चन. डेड बोन का which is the most important finding of the dead bone? Which is the most important finding of the dead bone? Maceration. What are two radiological signs of the dead bone? What are the two radiological signs of the dead bone? Number one, Roberts sign. Okay. Number two, Spalding sign. Which is the earliest sign of the dead bone? Okay. R for Roberts sign and R for rigor mortis. दोनों याद रखना. R for Roberts sign, R for rigor mortis present. Now, in live bone, what happens? In live bone, what happens? Air entry is there. So lung having air entry, diaphragm position goes low. Diaphragm goes to the 6 to 7. Now, sir, this question comes. What are the tests for air entry in live bone? What are the tests for air entry in live bone? See, Radine test. Dr. Saab, Radine test. First, how to remember? Radine has two E. It is air goes in ear. That's a very simple trick. If air goes in ear, that, Dr. Saab, why air goes in ear? When you respire, some amount of air from trachea goes to the middle ear. This is air goes in ear. This is known as Radine test. This is known as Radine test. Air goes in ear. याद कैसे करना? Radine has 2E, air goes in ear. That is a test of live bone. Now, Breslau second live test. Breslau S. Second is also S. Here, air in stomach. Dr. Saab, some amount of air when you are respirating goes in stomach. It is Breslau second live test. It is Breslau second life test. So that's very simple. E air in ear. Breslau second 2S air in stomach and intestine. Fodere test. Doctor C. FODER Fodere. After respiration, lung weight become twofold. That is a very simple trick. F for Fodere, F for lung weight become twofold. Before respiration, it is 30 gram. After respiration, R plus means after respiration, it is 60 gram. तीनों की ट्रिक होगी. E for ear, Breslau, air in stomach, Fodere, lung weight become twofold. Twofold. This is very simple. Now I am coming to, sir, Ploquet test. How to remember? P for Ploquet test, it is a test of proportion. It is a test of proportion. Proportion of lung weight divided by body weight. Doctor साहब देखो, E ear, Breslau stomach, Fodere twofold lung weight after respiration, and Ploquet proportion of lung weight divided by body weight. Doctor साहब, before respiration, lung weight divided by body weight is 1/70, and after respiration 1/35. It means that this is high. Lung weight divided by body weight after respiration is more. That is 1/35. Now, sir, I am coming to the last test, hydrostatic test. Last test, hydrostatic test. चलो मैं आपसे सवाल पूछता हूँ. Air in middle ear, what is the name of test? Air in middle ear, what is the name of test? Radine. Air in stomach and intestine after live birth, what is the name of test? What is the name of test? Breslau second life test. Breslau second life. Okay. Lung weight become twofold. What is the name of test? Fold. Twofold. Twofold. And lung weight divided by body weight proportion is known as, what is the name of test? Yes. It is Plauquet test. तो तीनों चारों की ठीक बता दी. Now sir, the last test is hydrostatic test. Now sir, the last test is hydrostatic test. What is hydrostatic test, sir? It is also known as Regard test. It is also known as Regard test. Hydrostatic test is also known as Regard test. And it is also known as Breslau first life test. It is also known as Breslau first life test. Breslau first life test. Breslau second life test was for stomach. It is Breslau first life test. What we do, sir? What we do here? We put lung pieces in water. This is water. We are putting lung pieces in water. Sir, if lung pieces are floating, your hydrostatic test is positive. This is live bone. If lung pieces are floating, your hydrostatic test is positive. This is a live bone. That's a very, very simple. And Dr. Saab, why lung pieces float after respiration? Presence of residual volume, first answer. Second, after respiration, specific gravity of lung is 0.94, that is less than 1. After respiration, specific gravity of lung is 0.94, that is less than 1. Chalo sir, revise karo. What are other name of hydrostatic test? What are other name of hydrostatic test? Number 1, Regard. Number 2, Breslau first life test. So my question for you, Breslau first life test is a test for stomach or lung? Stomach or lung? Lung. Breslau second life test is for stomach or lung? Stomach. When we are putting lung pieces in water, if lung pieces are floating, that is a positive hydrostatic test. Now third question. Positive hydrostatic test is because of presence of which volume in lung? Which volume in lung? Residual volume. And why? Because specific gravity of lung become more than 1 or less than 1? More than 1 or less than 1? Less than 1. That is 0.94. That is 0.94. Very good, my dear friend. These are the reason that hydrostatic test is positive. Now, sir, all tests are done. Reading for ear, Breslau second done. Now, sir, in live birth, after birth, there are 3 umbilical structure. What are these 3 umbilical structure? Umbilical artery, umbilical vein, and umbilical cord. Very simple trick, ABC. Artery closes on third day. Artery closes on third day. Vein closes on fourth day. And cord fall on 5th to 6th days. And Dr. Saab, these questions come in anatomy also. Artery closes on third day and it forms medial umbilical fold. Artery closes on third day, it forms medial umbilical fold. Vein closes on fourth day, it forms ligamentum teres. Ligamentum teres. And Dr. Saab, cord fall on 5th to 6th days. Cord fall on 5th to 6th days. Now question. Umbilical artery closes after how many days of birth? After how many days of birth? Okay, let me get your answer. 3rd days. Umbilical artery forms which ligament? Umbilical artery forms which ligament after birth? Medial umbilical fold or medial umbilical ligament. Umbilical vein forms which ligament? Umbilical vein forms which ligament? Ligamentum teres. Vein closes on which day after birth? Vein closes on which day after birth? 4th day. Umbilical cord fall on which day? Umbilical cord fall on which day after birth? Yes, it is 5th to 6th days. Now, sir, next topic for infant is SIDS. SIDS is sudden infant death syndrome. Sometimes, sir, infant die in his bed. This is known as sudden infant death syndrome. This is also known as cot death or crib death. Cot death or crib death. Now, Dr. Saab, it is also known as, what is the cause of death? Cause of death is sleep apnea. During sleep, suddenly respiration stop That is the cause of SIDS, sudden infant death syndrome. And doctor, if person died due to, an infant died due to SIDS, it is a negative autopsy. Doctor, anyone, I'm asking two questions to you. I'm asking two questions to you. First question, if you are conducting postmortem, gross analysis, chemical analysis, toxicological analysis, histopathological examination, even after that, you are not able to find the cause of death, what this is known as? Negative autopsy. Yes, laryngeal spasm and vagal inhibition. Now, if you have minimal finding, but you are not able to ascertain exact cause of death, you have minimal finding, but you are not able to ascertain exact cause of death, but you know that this is the cause of death. This is known as which autopsy? Obscure autopsy. Non-invasive method of autopsy is known as virtual autopsy. Very good. Suicide cases like Sushant Singh Rajput cases, we ask question to the family member, what is the name of this autopsy? Psychological autopsy. Relative give consent for cause of death which is done for academic purpose is known as पैथोलॉजिकल ऑटोप्सी. वेरी गुड भाई साहब, आप सब हीरा हो भाई साहब, हीरा. क्या हो आप सब? हीरा. But in SIDS we have negative autopsy because sir, sleep apnea is never diagnosed by autopsy. Sleep apnea is a loss of respiration during sleep. It is never diagnosed. Now sir, two important IPC, 317 IPC, 318 IPC. What is this? How to remember? ABC. ABC. What is ABC? Abandoning the child below 12 years of age. If you leave any child at any place below 12 years of age, it is 317 IPC. डॉक्टर साहब याद कैसे करोगे? 317. अगर आपने बच्चे को कहीं छोड़ा तो बच्चे को है खतरा और आपके ऊपर लगेगी abandoning the child IPC. 17 में है बच्चे को खतरा और आप पे लगेगी 317 IPC. If you abandon the child at any place, like you are leaving a child in orphanage, temple, mosque, whatever. Concealment of birth. What is the trick to remember, sir? A, B, C. A, B, C. Concealment of birth. If you do not notify the birth, it is punishable under 318 IPC. 318. 308. 318. Okay, done. Concealment of birth. Battered baby syndrome, my dear friend. Battered baby syndrome is also known as cafe syndrome. Battered baby syndrome is also known as cafe syndrome. If child is frequently bitten, by parents, this is known as battered baby syndrome. Doctor Saab, there will be multiple injuries on the body, and these injury will have multiple duration. Multiple injury of the body with multiple duration. On rib, you will have fracture. This is known as string of bead appearance. In rib, you will have fracture. This is known as string of bead appearance. Subdural hematoma plus intraocular bleeding. This intraocular bleeding is known as dot and blot hemorrhage. And Dr. Saab, this is seen in shaking baby syndrome or infantile V plus syndrome. See, sir, rib have a fracture. On X-ray, it will look like string of bead appearance. But sir, if you are frequently shaking your baby, naspite, frequently shaking, there are two hematoma very common. One is subdural hematoma. Second is intraocular bleeding. This combination, intraocular bleeding is known as dot and blot hemorrhage. This combination is known as shaking baby syndrome or infantile V plus syndrome. Skull fracture. Skull fracture is known as eggshell fracture. Skull fracture is known as eggshell fracture. Metaphyseal fracture is known as bucket handle fracture. And Dr. Saab, I have already told you butterfly bruise. Anyone? Butterfly bruise is an example of which bruise? Ectopic, artificial, or patterned? Yes, Sanu Saran, it is a pattern bruise. Sanu Saran, absolutely right. It is a pattern bruise. चलो मेरे साथ revise करो. What is another name of battered baby syndrome? What is another name of battered baby syndrome? What is another name of battered baby syndrome? Anyone? Cafe syndrome. You will have multiple injuries in same duration or multiple duration. Multiple duration. Rib fracture is known as string of dash dash dash. Rib fracture is known as string of dash dash dash. Bead opinions. String of bead opinions. Subdural hematoma plus intraocular bleeding. This combination is known as dash dash baby syndrome. Dash dash baby syndrome. Shaking baby syndrome, or it is also known as infantile dash dash syndrome. Infantile dash dash syndrome. Yes, infantile whiplash syndrome. Skull fracture are known as eggshell fracture. Metaphyseal fracture are known as bucket handle fracture, and pattern bruise are known as yukes. Pattern bruise are known as butterfly bruise. Pattern bruise are known as butterfly bruise. Butterfly bruise. Dr. Saab, there is a term which is known as uxoricide. What is uxoricide? If you are killing your partner, husband is killing wife, wife is killing husband, boyfriend is killing girlfriend, girlfriend is killing boyfriend. This word is known as uxoricide. 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 Child is killed by parents known as anyone. Child is killed by parents known as anyone. Filicide. Partner killing the partner is known as uxoricide. Uxoricide. Very, very important. Now, sir, we are coming to some definition. Write down. Impotence. What is the meaning of impotence? Sir, if male is not able to perform sex, if I'm a male, I'm not able to perform sex, I'm an example of impotent. Dr. Saab, most common cause of impotency is psychogenic. Very common cause of impotency is psychogenic, temporary fear. You are stressed, you are not able to perform sex. Sir, quad is a impotent to a particular girl. Quad is a impotent. If a male is impotent for a single girl, if I am a male, I am not able to perform sex only with a single girl, that is an example of quad. Quad. Doctor, next word is frigidity. Next word is frigidity. Frigidity, if male is not able to sexually arouse a female. I am a male, but I'm not able to sexually arouse my female girlfriend, female wife. That means I am frigid. It's a type of impotency. देखो, सेक्स नहीं कर पाना impotency, एक लड़की के लिए सेक्स नहीं कर पाना quad, और आप अगर किसी लड़की को sexually arouse ना कर पाओ तो that is frigidity. And Dr. Saab, impotency and frigidity both are ground for divorce, but sir, frigidity is more common because if you are not able to sexually arouse your wife, Dr. Saab, wife will file a case of divorce कि मेरा मर्द नामर्द है, मेरा मर्द नामर्द है, मेरा माहौल नहीं बना पाता, मेरे को सेक्सुअली अराउज नहीं कर पाता, क्या करूं मैं इसका? So Dr. Saab, that's a very, very important one. Yes, frigidity is a ground of divorce. Impotence is also ground of divorce, but frigidity is more important. अरे क्या हुआ रिकी ठाकुर, मजा आ गया? So this is regarding sex. This is regarding sex. Now we have discussed sex. Now how to produce children. If you are not able to produce children, you are sterile. But Dr. Saab, sterility is not a ground for divorce. If husband and wife have some problem, not able to produce children, sir, this is sterility, but it is not a ground of divorce. अगर आप बच्चे पैदा नहीं कर पा रहे हो तो तलाक नहीं दे सकते, बट अगर आप सेक्स नहीं कर पाते हो, सेक्स में अराउज नहीं कर पाते हो, दैट मीन्स यू हैव सम प्रॉब्लम. सर आपकी बातें मजे ले रहे हो भैया, मजे ले रहे हो. ओके, So anyway, sterile. अरे माहौल बना रहा हूं तुम्हारा यार. Sterile means you are not able to produce children. That means you are sterile. That may be male as well as female. That may be male as well as a female. Okay. Now, sir, there is a word comes which is known as posthumous child. There is a word come. This is known as posthumous child. What is posthumous child? Posthumous child is child born after death of father. Child born after death of father. Any child born after death of father is a posthumous child. Any child born after death of father. Doctor Sahab, what is posthumous? Post means after, humus means human की death के बाद. Child born after death of father is posthumous child. Posthumous child. Supposititious child, sir. Supposititious means it is a fictitious child. Sir, child never born, but still you claim the child for blackmailing. Doctor Sahab, I am not pregnant, but I tell some person that I am a pregnant. I have your child for blackmailing. This is supposititious child. It is used for blackmailing. Even I'm a pregnant for some other person, but I blackmail some other person. This is also supposititious child. So supposititious child is a fictitious child. It is used for blackmailing. It is used for blackmailing. Again, posthumous child is a child born after death of father. तो मेरे साथ दो चीजें रिवाइज कर लो. Sir, पहला question. If male is important for a particular woman, what is this male is known as? Particular woman, if you are important, what is the known as? Quad. If child is born after death of father, it is known as
posthumous child.
Posthumous child. If you use your pregnancy as a blackmailing purpose, what this child is known as, which is never born. The child is never born, but you use for blackmailing, supposititious child or fictitious child. Now, sir, this question comes in obs gynae also, superfetation and superfecundation. Doctor Sahab, in superfetation, we have 2T, and in superfecundation, we have 1T. Doctor Sahab, 2T means 2 cycle, 1T means 1 cycle. If 2 ova are fertilized in 2 cycle, this is a very simple trick I have made for you. If 2 ova are fertilized in 2 cycle, that is superfetation. And if 2 ova are fertilized in 1 cycle, that is superfecundation. Definitely there will be twin pregnancy. Definitely there will be twin pregnancy. Twin pregnancy. Okay. Now, sir, I'm coming to the next word. There were 2T, 2 cycle, 1T, 1 cycle. इससे easy trick नहीं बना सकता. Now we are coming to artificial insemination. Doctor Sahab, artificial insemination. What is artificial insemination? Yes, sir. You are depositing semen artificially, not by sex. Or surrogacy. Another word is surrogacy. We hire a female. Doctor Sahab, artificial insemination, we use donor, like wiki donor. 1 ml of semen is sufficient, and a single donor can produce maximum 10 children. It's not like wiki donor, जिसने पूरा गांव बसा दिया. Single donor can produce maximum 10 children. We only require 1 ml of semen. What is surrogacy? Sir, in India, only altruistic surrogacy is legal. What is altruistic surrogacy, sir? Altruistic means surrogate mother, we only will give medical expenses, other money is not given. It means, sir, only altruistic surrogacy is allowed. Surrogate mother should be close relative to you. No other expenses will be given. Only medical expenses will be given. That is to surrogate mother. Now, sir, after artificial insemination and after surrogate mother, child is born. आपको बच्चा पैदा हो गया. बधाई हो. Doctor Sahab, this child has to be adopted. Then this child will be a legal child. Doctor Sahab, adoption is mandatory. Adoption is mandatory. It is not adultery. Artificial insemination and surrogacy, we are taking help of other person, other donor. It is not adultery. Why it is not a adultery? Why it is not a adultery, sir? Because husband and wife both are giving consent. Because husband and wife both are giving consent. So, sir, for surrogacy as well as for artificial insemination, consent is taken from husband as well as wife. husband and wife. चलो मैं आपसे कुछ सवाल पूछता हूँ. Two MC cycle, two OR fertilize. What is the name of method? Superfetation or superfecundation? Superfetation. A single donor can produce how many maximum children? 10. What is the amount of semen required? Yes, 1 ml. In India, which surrogacy is legalized? Altruistic or commercial? Altruistic. In surrogacy and artificial insemination, consent is required from husband, wife, both. Husband, wife, both. Yes, both. Very good. Now, sir, we are coming to hymen. Sir, hymen is a fold of mucous membrane surrounding vagina. Sir, this is vaginal orifice. This is hymen. This is hymen. Hymen. Now, Dr. Saab, hymen most common type is semilunar. Most common, 70% female has this type of hymen, that is semilunar or crescentric. This is the most common hymen. Semilunar or crescentric, both are same. Dr. Saab, after sex, this is sex. After sex, hymen ruptures most commonly. After sex, hymen ruptures most commonly. See, this is hymen. Hymen ruptures most commonly at 5 to 7 o'clock position. This is the position at which hymen ruptures. This is position at which hymen ruptures. 5 to 7 o'clock position. Yes, this is the position. This is the position from 5 o'clock to 7 o'clock position. This is posterolateral. Most common site of hymen ruptured is posterolateral. This is the commonest site, posterolateral. Dr. Saab, sometime what we do, चलो सवाल लिखो. Which is the most common type of hymen, my dear friend? Which is the most common type of hymen in female? Semilunar. What is the most common site of rupture of hymen during sex? Anterolateral or posterolateral? Yes, it is posterolateral. What is the position of ghadi, clock, at this where hymen gets ruptured? Yes, 5 to 7 o'clock. Now, sir, few prostitutes or call girl, what they do? They insert solapith. What is solapith? Solapith is a plant stem. This solapith they insert in vagina. And Dr. Saab, due to this insertion in vagina, hymen gets ruptured and vagina is dilated. Prostitute inserts solapith. Solapith is a plant stem that is inserted in vagina, and when this is inserted in vagina, vagina gets dilated and hymen ruptures. Hymen rupture. This is few prostitute use solapith to dilate vagina. Now, sir, virginity word is used for male as well as for female, but mainly virginity word is used for female. If female lost virginity, this is known as defloration. If female lost virginity, this is known as defloration. Dr. Saab, two type of virgin female we have. One is true virgin. What is true virgin? A female who has never participated in sex, no sex, but hymen may be ruptured, may be intact. Because hymen can be ruptured by many other methods. Female who never participated in sex, but hymen may be ruptured, may be intact, plus minus. What is false virgin? Sir, female participated in sex. Yes, right kiya hua hai. But still hymen is intact, my dear. Still hymen is intact. The reason is, sir, some female has elastic hymen. Even after sex, hymen is not ruptured because of elasticity of hymen. Now, sir, write down MCQ. Which plant stem generally prostitute used to insert to dilate vagina? What is the name of that plant stem? Yes, Jabin Solapit. Virginity is lost. What this word is known as? Virginity is lost. What this word is known as? Defloration. Dr. Saab, female participated in sex, but still hymen is intact. It is true virgin or false virgin? Yes, participated in sex, still hymen is intact. It's a false virgin. Which type of hymen is present in false virgin? Which type of hymen is present in false virgin? Elastic hymen. Yes, friends, it is elastic hymen. Now, sir, medical abortion. Dr. Saab, what is the meaning of medical abortion? Which is medically done. I told you criminal abortion, which is done criminally, that is an offense. Medical abortion, which is done medically, which is indicated. So medically indicated abortion is known as medical abortion. Medically indicated abortion is known as medical abortion. Sir, for medical abortion, we have some act in India. First very important act is MTP Act, Medical Termination of Pregnancy Act. Dr. Saab, it was implemented in 1971. Medical termination of pregnancy. How do we terminate pregnancy medically? That is known as MTP Act. MTP Act. What are the indication? Sir, first, social indication. What is social indication? If contraceptive is failed, you can go for medical abortion. If contraceptive is failed, you can go for medical abortion. First, if child is malformed, this is eugenic indication. If child is malformed, this is eugenic indication. You can go for medical abortion. Therapeutic. You can remember by trick SETH. That's very simple. Set. Eugenic is child is malformed. Therapeutic. Therapeutic is if mother life is in danger. If mother life is in danger, that is therapeutic indication. And humanitarian grounds, sir, if pregnancy is a result of rape. If pregnancy is a result of rape. Again, I'm revising. Contraceptive is failed, you can go for abortion. Child is malformed, you can go eugenic. Mother life is in danger, you can go for abortion. If pregnancy is a result of rape, you can go. Dr. Saab, here consent of mother is valid. Here consent of mother is valid. No other consent is valid. Consent from mother is valid. Age of the mother should be above 18. And Dr. Saab, if below 12 weeks, one doctor help is required. If below 12 weeks, one doctor help is required. Between 12 to 20 weeks, two doctor help is required. Between 12 to 20 weeks, two doctor help is required. But sir, there is one amendment now. There is one amendment in 2020. This is MTP bill. This is MTP bill. According to this MTP amendment bill, Dr. Sahab, according to this MTP amendment bill, so by this we can go for MTP only for 20 weeks. Here you can go for MTP for 24 weeks, up to 24 weeks. This was bill. And Dr. Sahab, one important thing here, one doctor is required up to 20 weeks, and for 20 to 24 weeks we require two doctors. But sir, again I'm telling you, it is a bill, not a act. It is a bill, not a act. It has been passed from the Lok Sabha, Rajya Sabha, it is pending. Dr. Saab, listen very carefully. मैं आपसे सवाल पूछता हूं. According to MTP Act, medical abortion is indicated up to what? How many weeks? According to MTP Act, medical abortion is indicated up to how many weeks? Dharni, no, my dear friend. Damodaran, you are right. It is according to MTP Act. According to MTP Act, it's a bill, which I told you. Yes, answer is 20 weeks. And according to MTP Act, below 12 week, one doctor, 12 to 20 week, two doctor. But sir, if you get a specific question, according to 2020 Amendment Bill, MTP, medical termination of pregnancy, is indicated up to, up to, up to 24 weeks, and one doctor is allowed to terminate the pregnancy up to 20 weeks, 20 to 24 weeks. Dr. Saab, see the question very carefully, because it is not an act till now, it is just a bill, MTP bill. I have cleared this doubt, no doubt. Now, Dr. Saab, some abortifacient drug. First is ergot. E for ergot, it is a ecbolics. E for ergot, it is ecbolic. What is the mechanism of ergot? It increases uterine contractility. It increases uterine contractility, it causes abortion. So what is the trick to remember? E for ergot, E for ecbolic. It increases uterine contractility and causes abortion. This is ergot. Ergot. Now, second, E for amenogogues. It increases menstrual blood flow and fetus is out. It increases menstrual blood flow. Again, I am revising, sir. E for ergot, E for ecbolics. E for amenogogues, it increases menstrual blood flow and fetus is out. Fetus is out. Absolutely right. Fetus is out. अरे एमटीपी पूछा हो तो वो एक्ट होगा भाई, बिल में मेंशन होगा. अभी तक बिल एक्ट में कन्वर्ट नहीं हुआ है. अगर सिर्फ एमटीपी पूछा तो वो एक्ट के बारे में पूछ रहा है, क्योंकि एक्ट का मतलब कानून. What are the amenogogues in India we use for abortifacient abortion? BOS, BOSS, BOS. B for borax, E for estrogen, S for sanguinary, S for senecio. Sometimes you get a very simple question. Amenogogues mechanism is increase pelvic blood flow, is increase menstrual blood flow. In rape case below 18 years, only the victim consent enough. मतलब Dr. Saab, rape case below 18 of age of female, victim cannot give the consent. Consent will be taken from parents because victim is minor. Victim is minor. Okay. And Dr. Saab, it is a rape case, always rape case. Below 18, even with consent, it's a rape. With consent, it's a rape. It's a statutory rape, I told you. Amenogogues increase menstrual blood flow. What are the example of amenogogues? BOS, borax, estrogen, sanguinary, and senecio. These are the example of amenogogues. Now, sir, abortion stick. Now, sir, abortion stick. These are the plant stick, 12 to 18 centimeter. They are inserted in the vagina. They causes vaginal irritation and fetus come out. Again, I'm telling you, ecbolic increases uterine contraction. Amenogogues increases menstrual blood flow. Example are BOS. Ecbolic is ergot. Abortion stick, 12 to 18 centimeter, inserted in the vagina, irritation take place. What are the example of abortion stick? P. colas. P. colas. What is P. colas? Sir, P for plumbago. P for plumbago. E for ergot. C for calotropis. Most commonly used is calotropis. Calotropis is also known as akdo or madar. O for oleander. L for lead. There is a product of lead which is known as dichylone. A for aconite, Abrus precatorius, and arsenic. And S for strychnine. S for strychnine. Dr. Saab, this is P. colas. P for plumbago. E for ergot. C for calotropis. O for oleander. L for lead. Lead product is dichylone. Calotropis is most commonly used. It is known as akdo or madar. S for strychnine. And Dr. Saab, A for aconite, Abrus precatorius, and arsenic. S for strychnine, U for utus pest. Utus pest is a potassium chloriodide plus iodine. This is also used for killing a fetus. Again, I'm revising, sir. Mechanism of abortion stick is vaginal irritation. Mechanism of amenogogs are increased blood flow. Mechanism of ecbolics are increased uterine contraction. Example of ecbolics is ergot, EE. Amenogogs is bos, borax, estrogen, sanguinary, senecio. An example of abortion stick are P. colas. Most commonly used is calotropis. Dichelone is a product of lead. Utus pest is a combination of potassium iodide plus iodine. It is also a abortifacient. It is also a abortifacient. It is also a abortifacient. Okay. Now, sir, write down some MCQ. Write down. What is the mechanism of ecbolics? What is the mechanism of ecbolics? Anyone? Yes. Uterine contraction. Absolutely right. Answer is uterine contraction. Very good. Answer is uterine contraction. What is the mechanism of amenogogs? Amenogogs. Yes. Increase pelvic blood flow. What is the mechanism of abortion stick and what is the length of abortion stick? What is the mechanism of abortion stick and what is the length of abortion stick? Length is 12 to 18 centimeter and mechanism is increased uterine contraction. Increase uterine contraction. Okay. What is the most commonly used abortion stick? Most common plant? Calotropis is the most common plant, no doubt. Calotropis is the most common plant. Okay. Product of lead is known as dichelone. Product of lead is known as dichelone. Utus pest is a combination of, what is utus pest? Utus pest is a combination of, yes, potassium iodide plus iodine. Okay, so you can see this picture, adipose hair. As I told you, when adipose hair become dry, it become yellow and dry. This is a Clostridium welchi contribution in warm and humid climate. It is Clostridium welchi contribution in warm and humid climate. In warm and humid climate. This is known as adipose hair. This is known as adipose hair. Adipose hair. So this image is not given. This image is not given in your PowerPoint. So you just get the snapshot screen. Just get the snapshot of this. This is mummification. This is not given. This is mummification. Just write down mummification. Dehydrated body. Dehydrated body. This is known as mummification. Mummification, you write down. This is mummification. Okay. Mummification. Another image which I have not shown you. You can get the pic of that image. Search this one. This one. Anyone who can tell me what is the name of the sign? Anyone who can tell me what is the name of the sign? Anyone? I'm expecting this answer from you. Anyone? Anyone? Actually, this image came in one exam. Yes, sir, it is a battle sign. Yes, Jabin, it is a battle sign. Very good. It is a battle sign. Bruise at mastoid tip by middle cranial fossa. It is ectopic bruise. It is a battle sign. It is a battle sign. Dr. Saab, This is another image. Anyone? What this is? One minute. 1 minute. Let me share this image to you. Now, anyone? This injury is incised looking lacerated wound or lacerated looking incised wound? Anyone? This injury is incised looking lacerated wound or lacerated looking incised wound? Anyone? I want to get the answer. Okay. Yes, friends. Yes, Dharani. Yes, Jabin. Yes, Damodaran. Absolutely right. It is incised looking lacerated. It is incised looking lacerated wound on scalp. It is incised looking lacerated wound on scalp. Very, very good, my dear friend. Very, very good, my dear friend. I'm proud of you. आपने बहुत ही अच्छा बताया है. These are some more images which are supposed to be discussed, and I discussed these. Now, Dr. Saab, the last part is left. That is toxicology. Last part is left. That is toxicology. Now, how to save this here? I don't know. हर कोई इसको सेव कैसे करते हैं ये मालूम है क्या? Save as. Okay. Now I am able to save this. FMT. For class. Okay, done. Okay, sir. So now after this, we'll start the last topic is toxicology. It's a very easy topic. याद करने वाला है, रटने वाला है. Now, toxicology. Toxicology, the father of toxicology is Orfila. Father of toxicology is Orfila. Toxicology is study of poison. Toxicology is study of poison. But there is one more branch which is known as toxinology. There is one more branch which is known as toxinology. What is toxinology? Study of living toxin. Study of living toxin. Living toxin की study को बोलते हैं toxinology. Father of toxicology is Orfila, study of poison. Now we can see the different type of poison. Living toxin, snake. Snake poisoning study is known as ophiotoxemia. Snake poisoning study is known as ophiotoxemia. Snake poisoning study is known as ophiotoxemia. Scorpion is also a living toxin. Sir, for scorpion we use prazosin. For scorpion we use a drug, prazosin. This question comes, prazosin is a drug used for scorpion. Spider is also a living toxin. Spider is also a living toxin. Most poisonous spider is black widow. Most poisonous spider is black widow. सबसे poisonous spider है black widow. Spanish fly is also a living toxin. Sir, when Spanish fly bite you, there is a cantharide poisoning. When Spanish fly bite you, we have a cantharide poisoning. Spanish fly is also known as Indian blister beetle. Spanish fly is also known as Indian blister beetle. Indian blister beetle. And in Spanish fly, we have a symptom which is known as priapism. What is priapism? Priapism is painful erection of penis. Painful erection of penis. चलो कुछ MCQ लिखो. Who is father of toxicology? Who is father of toxicology? Orfila. Study of snake poisoning is known as ophiotoxemia. Ophiotoxemia. Spanish fly causes which poisoning? Spanish fly causes which poisoning? Cantharid poisoning. Cantharid poisoning. Study of living toxin is known as toxinology. Toxinology. Cantharid causes a symptom which is known as priapism. Priapism is painful erection of penis. Priapism is painful erection of penis. Now, sir, plant toxin and bacterial toxin are also living toxin. Sir, plant produces toxalbumin. Plant produces toxalbumin, and mechanism of toxalbumin is RBC agglutination. Mechanism of toxalbumin is RBC agglutination. Now we'll discuss plant and Dr. Wherever I write down FD, that will be fetal dose. Now here, plant toxin produce toxalbumin. Mechanism of toxalbumin is RBC agglutination. Name of the plant and number of seed as a fetal dose. Now, Doctor, what is a trick? I just made a very simple trick. Sacred games. C for strychnine, A for abrus, C for croton. These are the name of plant. R for ricinus and D for datura. Number of seed as a fetal dose. In the same section, strychnine fetal dose, 1 seed is a fetal dose. Abrus, 1 seed is a fetal dose. Croton is also known as Jamal Gota. Croton is also known as Jamal Gota. 4 seed are a fetal dose. Ricinus is also known as castor plant or arundi. 10 seed as a fetal dose, and datura fetal dose is 100 seed. Strychnine and abrus 1 seed. Croton 4 seed. Ricinus and abrus 1 seed. Strychnine and abrus 1 seed is a fetal dose. Croton is Jamal Gota, 4 seed is a fetal dose. Ricinus, which is known as a castor plant or arundi, 10 seed are fetal dose. Datura 100 seed are fetal dose. Datura 100 seed are fetal dose. Doctor, you can get this question. Datura is a very common question you can get out of this. Okay. Now, sir, first we'll discuss strychnine. As I told you, 1 seed is a fetal dose, but 1 seed should be crushed. 1 crushed seed is a fetal dose of strychnine. 1 crushed seed is a fetal dose of strychnine. Doctor, strychnine is also known as Nux vomica. Strychnine is also known as Nux vomica. It acts on spinal cord and it acts on anterior horn cell of the spinal cord. It acts on the spinal cord, anterior horn cell of the spinal cord. Doctor, strychnine look like a disease that is tetanus. Strychnine look like a disease that is tetanus. So just like a tetanus, we have trismus. Trismus is lockjaw. Doctor, this question comes very common. Strychnine is a Nux vomica. It acts on spinal cord anterior horn cell. Spinal cord anterior horn cell. It look like a disease that is tetanus. And Doctor, C. Here, just like a tetanus, we have lockjaw. Most common position is opisthotonus. Most common position of strychnine is opisthotonus. What is opisthotonus? Hyperextension of the back. Opisthotonus is hyperextension of the back. Wherever I write down AD, antidote for strychnine is diazepam. Antidote for strychnine is diazepam. Now write down 2 or 3 MCQ. What is a fetal dose of strychnine, my dear friend? How many seeds? How many seeds is a fetal dose of strychnine? 1 crushed seed. 1 crushed seed. Where it acts spinal cord. Where it acts spinal cord. Most common position is which position, my dear friend, for strychnine? Yes, it is opisthotonus. Opisthotonus is hyperextension of the back. And as I told you, sir, strychnine look like which disease? It is looking like tetanus. Strychnine look like a disease that is tetanus. Now I am coming to, sir, Abrus precatorius. 5 important A. A for Abrus precatorius. Yes, done. A for abrine and abrylene are toxin. A for Abrus precatorius. A for abrine and abrylene are toxin. Dr. Saab, A for it is an animal poison. A for it is an arrow poison. A for it is used as an abortion poison. Dr. Saab, 5A, Abrus precatorius. Abrine and abrylene are toxalbumine. It is an animal poison, arrow poison, and abortion poison. Dr. Saab, these two questions comes in exam. This is also known as Ratti or Indian licorice. This is also known as Ratti or Indian licorice. Sir, abrine and abrylene act like a viper venom. Abrine and abrylene act like a viper venom. Sir, it is an animal poison. For killing animal, we make needle. Needle means sui. For killing animal, we make needle and sui. If you see the seed of Abrus precatorius, it is a red seed with black top. Red seed with black top. Doctor, you can get few questions. Write down MCQ. What are other name of Abrus precatorius? What are other name of Abrus precatorius? Ratti and licorice. Ratti and licorice. It is most commonly used as an animal poison. Doctor, if you get a question, which is the most common animal poison, the answer will be Abrus precatorius. Needle and sui are used. It is abrine and another question. Abrine and abrylene mechanism is just like which venom? Abrine and abrylene mechanism is just like which venom? Viper venom. Yes, it is viper-like venom. Now, sir, another important poison is Datura. Daksal, D for Datura. D for it is a 9D poison. D for it causes delirium. D for Datura. There are 9D symptoms. It causes delirium. Dr. Sahib, it is a anticholinergic plant. It is a anticholinergic plant, Datura. 9D symptom. There are 9D, drunkenness, diplopia. But sir, this is a very important MCQ. There is no diarrhea. Anticholinergic symptom is a constipation. So there are 9D symptom, but there is no diarrhea. Doctor Saab, in delirium, you become sleepy. आप सो जाते हो. That's why it is most common roadside poison or most common railway side poison. It is most common roadside poison or most common railway side poison. Most common, Dr. Saab, because of delirium. Because of delirium. Datura alba is a white Datura. Albinism is a white. Datura niger, negro, is a black Datura. Datura stramonium is a thorn apple because it contains thorn. Datura stramonium is a thorn apple. So Datura is an anticholinergic plant. There are 9D symptoms. It causes delirium, most common roadside poison. Datura stramonium is a thorn apple. I will show you the picture also. And Dr. Saab, thorn apple is Datura stramonium. Datura stramonium is thorn apple. We use two antidote for Datura. Dr. Saab, how to remember? 2P. PP. तो अगर आप किसी को धतूरा देते हो तो उसको बोलते हो पी ले यार पी that's a trick. So first antidote is physostigmine, second antidote is pilocarpine. First antidote is physostigmine, second antidote is pilocarpine, physostigmine and pilocarpine. This is Datura. This is Datura. याद करना डॉक्टर साहब, which Datura species is thorn apple? Which Datura species is thorn apple? Datura stramonium. Which Datura species is black Datura? Black Datura. Datura niger. What is a fetal dose of Datura? How many seeds? How many seeds are fetal dose of Datura? 100 seeds. What are the antidote of Datura? 2P. PP. P for physostigmine. P for pilocarpine. Datura is most commonly used as a dash poison. Datura is most commonly used as a dash poison, railway side or roadside poison, because sir it causes delirium. Because sir it causes delirium. Now sir, ergot plant. Sir, ergot is prepared from a fungus. This fungus is a claviceps fungus. It's prepared from rye plant. Rye plant has this fungus. Dr. Saab, ergot poisoning causes tactile hallucination. What is tactile hallucination? You will see the insects are creeping on your skin. This is known as tactile hallucination. Tactile hallucination is also known as formication. And in ergot poisoning, there is inflammation of palm and sole. So again, I'm revising, my dear friend. ये एक फंगस से होती है. The name of fungus is claviceps. It causes tactile hallucination. It causes tactile hallucination. Ergot poisoning causes tactile hallucination. And we know it causes inflammation of palm and sole. It is common in the rye plant. Now, sir, chili powder. Sir, everyone knows chili is known as capsicum. The seed of chili causes dermatitis. Sir, this dermatitis is also known as Hunan hand. The seed of chili powder. The seed of chili powder causes dermatitis. This is known as Hunan. Hunan is a place in China. The name came from Hunan. This is chili. Now, sir, come to cannabis, another plant, cannabis. C for cannabis, done. C for CNS stimulant. C for 9-tetrahydrocannabinol, and C for charas. That's a very simple trick. Cannabis, cannabinol, CNS stimulant, charas. Charas is the most potent product of cannabis. It is prepared from stem. Charas is the most potent product of cannabis. It is prepared from stem of cannabis. Now, Dr. Saab, C is done. C is done. Now come to the D. Digipalm is an antidote. D. Digipalm is an antidote of cannabis. We have discussed C. C for cannabis sativa is a plant. Charas is a product. D. Digipalm is an antidote. E. It is an excitatory plant. It excites your body. F. Female flower is used for making ganja. Dr. Saab, ganja are known as weed, reefer, and joint. Weed was very famous nowadays. Joint is also famous in India. Ganja is known as weed, reefer, or joint. From female flower, we form ganja. From female flower, we form ganja. So we have seen C is done, D is done, E is done, F for female flower, G is ganja. H, H is hashish. Hashish is another name of charas. Now, Dr. Saab, C, D, E, F, G, H. H are done. So now, what two alphabet are left? A and B. A and B. A for amok. Sir, there is a situation which is known as run amok. Dr. Saab, run amok is a homicidal and suicidal tendency in cannabis. Run amok is a homicidal and suicidal tendency in cannabis. B for bhang. Bhang is prepared from leaves. And Dr. Saab, B for burnt drop smell. B for burnt drop smell, that is also seen in cannabis. Burnt drop smell, that is also seen in cannabis. Cannabis product, burnt drop smell. M for majoon. Yes, majoon is a sweet product. M for marijuana. All product of cannabis are known as marijuana. All product of cannabis are known as marijuana. Now, Dr. Saab, आपसे MCQ पूछ लेता हूं. Sir, cannabis is a CNS depressant or CNS stimulant plant? CNS depressant or CNS stimulant plant? Okay. Hashish is also known as charas. Okay. Charas is prepared from which part of the plant? Which part of the plant? Charas. Stem. Homicide and suicidal tendency after cannabis is known as run amok. Run amok. Dr. Saab, which kind of smell is seen in cannabis? Which kind of smell is seen in cannabis? Burnt drop smell. Sweet product of cannabis is known as majoon. All product of cannabis are also known as marijuana. All product of cannabis is also known as marijuana. Now, sir, I am coming to opium. Sir, opium is also known as afim. Opium is also known as afim. Doctor, remember 4N. N for narcotic. Opium is a narcotic. M for NDPS Act for opium 1985. N for naloxone is an antidote, and naltrexone is a oral antidote. These are four important. N, narcotic, NDPS Act, narcotic, NDPS Act, naloxone is an antidote, and naltrexone is a oral antidote. These are four N. Now, sir, from papaver plant, P for papaver plant, opium is prepared. In papaver plant, we have poppy fruit. Doctor, what we do? In poppy fruit, we give vertical incision like this. Poppy fruit, we give vertical incision and opium is taken. There is plant has poppy seed. Sir, from poppy seed, we make khaskhas. Khaskhas is prepared from poppy seed. And Doctor, last P is pinpoint pupil. So we can remember four important P. Papaver is the name of plant. Poppy fruit is a name of fruit. We make vertical incision, we take poppy seed or khaskhas, and pinpoint pupil is seen in opium poisoning. Doctor, pinpoint pupil is seen in coma cases. Pinpoint pupil is seen in coma cases. Coma cases. Now, sir, by opium we have two products. One is opiate. Opiate are actually drugs. Opiate from opium are drugs. Drugs are morphine and codeine. Opiate are drug. Opioid are derivative of morphine. Example is diacetyl morphine. Opiate are diacetyl morphine. चलो कुछ MCQ करो. Which incision to the poppy fruit is given? Horizontal or vertical? Horizontal or vertical incision are given. Vertical. Which is an oral antidote for opium? Which is an oral antidote from opium? Naltrexone. Naloxone. Naloxone is the antidote of choice. Naltrexone is an oral antidote. NDPS Act implemented in 1985. Drug from opium are known as opiate or opioid. Opiate or opioid. Yes, it is opiate. And Doctor, derivative of diacetyl morphine. Diacetyl morphine. Doctor, what is diacetyl morphine? It is nothing but heroin. It is nothing but heroin. What are other name of heroin? Heroin is a white powder. Other name are smack, brown sugar, junk, dope. So revise karo. Heroin, smack, junk, brown sugar, and dope. All are same. All are same. For example, nasal inhalation. Nasal inhalation is known as snorting. And Doctor, this method is known as chasing the dragon. Nasal inhalation is known as snorting. This method is known as chasing the dragon. Doctor साहब, अभी आपके क्वेश्चन आया था huffing. Huffing is a method in which plastic polythene is used for inhalation. Huffing is a method in which plastic polythene is used for inhalation, but nasal inhalation is known as snorting. Snorting method is also known as chasing the dragon. Snorting method is also known as chasing the dragon. Chasing the dragon. In huffing, we use plastic bag. Okay, these are the name of heroin. Heroin, smack, brown sugar, junk, and dope. Heroin, smack, brown sugar, junk. Yes, it is bagging. Bagging is different. Bagging is different. I will tell you this term. Okay. Now heroin plus, it is bagging. It is bagging. Plastic bag is bagging. Heroin plus, I will tell you all four terms. Heroin plus cocaine. Sir, this is known as speedball. Heroin plus cocaine is known as speedball. This combination is known as speedball. Talks of heroin and cocaine. This combination is known as speedball. How these are taken, sir? Sir, cocaine. Now we are going to discuss cocaine. In cocaine, everything is C. C for coca plant. Cocaine is prepared from coca plant. Other name of cocaine is crack and coke. C. C, C, C. Cocaine is vasoconstrictor, another C. And in cocaine we have cocaine bug. Cocaine bug is a tactile hallucination. Very, very important, my dear friend. In cocaine we have cocaine bug, that is a tactile hallucination. Tactile hallucination. These are two very, very important. C for cocaine, C for coca plant, C for vasoconstrictor, C for C for C for vasoconstrictor, and C for cocaine bug. Cocaine bug is a tactile hallucination. Cocaine bug is a tactile hallucination. These are some very, very important words which are used for cocaine. Which are used for cocaine. Now, sir, if you smoke cocaine, your tongue and teeth become black. Doctor, when you inhale by snorting, there is a nasal septal perforation. This is a very important MCQ, my dear friend. Nasal septal perforation is very common in cocaine. And Doctor, cocaine tactile hallucination is known as Magnan symptom. Cocaine tactile hallucination is known as Magnan symptom. Cocaine tactile hallucination is known as Magnan symptom. Magnan symptom. Very, very important. Magnan symptom. Now, sir, sample. If you want to detect cocaine, sir, you will take the sample from nasal swab. If you want to detect cocaine, you will take the sample from nasal swab. Antidote for cocaine is amyl nitrite. Antidote for cocaine is amyl nitrite. Amyl nitrite. Now, Dr. Saab, write down some MCQ. Heroin plus cocaine is known as anyone? Speedball. What is a sample for cocaine poisoning? What is the sample for cocaine poisoning? Sample for cocaine poisoning is nasal swab. Very good. Nasal swab. Nasal swab. Sample for cocaine poisoning is nasal swab. Another important word. Then tactile hallucination is also known as which symptom? Tactile hallucination is also known as which symptom? Magnan symptom. Yes, it is known as Magnan symptom. What are the other name of heroin? Brown sugar, junk, yes, brown sugar, junk, and dope. Brown sugar, junk, and dope. These are the name of, yes, brown sugar, junk, and dope. Some important word which are used for cocaine. Write down, sir. Next word, snack poisoning. As I told you, snack poisoning is known as opisthosemia. Snack poisoning are also known as opisthosemia. Sir, C for cobra. Yes. C for common curate. C for coma. Cobra, common curate, coma. Fatal dose 12 milligram, 6 milligram, coma. Both all are neurotoxic. All are neurotoxic. Doctor Sahib, in cobra and common curate, cause of death is, because these are neurotoxic, respiratory muscle paralysis. Cause of death is respiratory muscle paralysis. There will be respiratory muscle will be lost because of coma, brain will be damaged, respiratory muscle paralysis will be there. Most dangerous is cobra. Why? Actually, sir, if you see, more poisonous is common curate, but most dangerous is cobra because amount of venom secreted is more in cobra. Amount of venom. Doctor Saab, common curate is more poisonous. Common curate is more poisonous, but cobra is more dangerous. Cobra is more dangerous. The reason is amount of venom is more secreted in cobra. Amount of venom is more secreted in cobra. Both causes respiratory muscle. CCC. Dr. Saab, V for viper, V for vasculotoxic. Dr. Saab, If we convert V, we have triangular head in viper, vascular toxic. So here, cause of death will be vascular toxicity. As for C snake, as for skeletal muscle paralysis, Roxas, very simple. CCC, CCC, cobra common crate coma, VV, viper vascular toxic. SS, C snake is skeletal muscle paralysis, myotoxic. Now treatment. How do we, and triangular head is seen in viper. Triangular head is seen in viper. Reassure the patient first. Reassure the patient first. Right. Immobilize with sling. Go to hospital and start the treatment. This is right strategy for snake poisoning. Reassure the patient first. Immobilize the patient. Reassure the patient first. Immobilize the patient by sling. Go to hospital. Then treatment. For treatment, we use anti-snake venom. For treatment, we use anti-snake venom. Dr. Saab, anti-snake venom is prepared in Mumbai in Hopkins Institute. Anti-snake venom we prepare in Mumbai in Hopkins Institute. 20 ml initial dose is given. 20 ml initial dose is given. Anti-snake venom should be used within 4 hours of the poisoning. Within 4 hours of the poisoning. 4 snake are used for making anti-snake venom. These 4 snake are cobra. These 4 snake are cobra, common karet, cobra, common karet, Russell viper, and so scale viper. Cobra, common karet, Russell viper, and so scale viper. For neurotoxicity, we use neostigmine as a drug. Sir, rat snake is a non-poisonous snake. For neurotoxicity, we use neostigmine as a drug. Rat snake is a non-poisonous drug. Non-poisonous snake. Now, sir, if you see poisonous snake, they have only 2 bite mark. Tail is compressed. उसकी पूंछ होगी वो compressed होगी. These are nocturnal. रात को घूमते हैं poisonous snake. Head scale are small and belly scale are large. Head scale are small and belly scale are large. Opposite will be non-poisonous snake. Chalo, Dr. Sir, write down. Write down one name of non-poisonous snake. Anyone? Write down one name of non-poisonous snake. One name of non-poisonous snake. Rat snake. How many teeth mark are present in poisonous snake? How many teeth mark? Bite mark? 2. Tail is blunt or compressed? Poisonous snake. Tail is blunt or compressed. Python अलग चीज है. Python snake उसमें नहीं आता. वो ग्रुप ही अलग है. Compressed. Compressed. Head scale of the poison snake are small or large? Head scale, small. Dr. Saab, cause of death in cobra and common karet is? Cobra and common karet is respiratory muscle failure. Dr. Saab, which is vascular toxic snake? For neurotoxicity, which drug is used? For neurotoxicity, which drug is used? Neostigmine. Now tell me, sir, what are the 4 snake which are used for anti-snake venom? What are the 4 snake which are used for anti-snake venom? Cobra, common karet, Russell viper, cobra, common karet, Russell viper, and so scale viper. Very good. Now, Doctor, we are coming to next poison, phosphorus. Sir, P for phosphorus, P for protoplasmic poison. P for phosphorus, P for protoplasmic poison. Doctor, phosphorus is mainly 2 types. One is white, another is red. One is white, another is red. Doctor, whenever you see red signal, everything is no. Whenever you see red signal, everything is no. It is non-toxic, no smell, non-luminous, no morphology. Everything is no. Red signal देखते ही non-toxic, no smell, no morphology, non-luminous. White plus red combination is known as yellow phosphorus. White plus red combination is known as yellow phosphorus. For white, everything is yes. It is toxic. There is a smell. It is luminous. There is a morphology. Fatal dose of white phosphorus, because it's a toxic, it's 60 to 120 milligram. Any compound, my dear friend, which contain phosphorus, it gives garlicky smell. Any compound of phosphorus which contain which is a which contain phosphorus, it gives garlicky smell. Doctor, white phosphorus is a Diwali poison used for making crackers. Red phosphorus is on the side of matchbox. Red phosphorus is used in the side of matchbox. Red phosphorus is used in the side of matchbox. Now, Doctor, what is an antidote? What is an antidote? CAP, cap. Antidote is C for copper sulfate. Along with copper sulfate, we use vitamin K. A for there is a tremor in phosphorus poisoning, which is known as asterexis. And there is a phossy jaw. Jaw become necrosed. That is a phossy jaw. Again, I am revising, my dear friend. Now write down. Which is a poisonous phosphorus? Which is a poisonous phosphorus? White or red? White or red? White. What is a tremor in phosphorus poisoning? What is known as tremor as a phosphorus poisoning? Asterexis. Asterexis is a tremor of phosphorus poisoning. What is the antidote of phosphorus poisoning? Antidote of phosphorus poisoning? Copper sulfate, CuSO4. Which vitamin is used in phosphorus poisoning? Which vitamin is used as a treatment of phosphorus poisoning? Yes, vitamin K. Absolutely right, friends. It is vitamin K. Which phosphorus is used in the side of matchbox? Side of matchbox. What will be the answer? Red phosphorus. White plus red phosphorus is known as, yes, it is yellow phosphorus. White plus red phosphorus is known. Which phosphorus is a Diwali poison? Diwali poison. What is a fatal dose of phosphorus in milligram? White phosphorus. 60 to 120 milligram. Now, sir, 62 garlic smell is seen in phosphorus poison. Now, sir, we are coming to mercury. Sir, see, M for mercury. M for mercury. M for mercury. M for Minamata disease. M for mercury. M for there is a Minamata disease in Japan by mercury poisoning. And M for Mercuria lentis. M for Mercuria lentis. Mercuria lentis is lens. Mercuria lentis is Mercuria lentis is anterior lens capsule deposition of mercury. Anterior lens capsule deposition of mercury. This finding is known as Mercuria lentis. This finding is known as Mercuria lentis. So again, I am revising. M for mercury. M for there was a Minamata disease of Japan due to mercury poisoning. M for Mercuria lentis. Mercuria lentis is mercury deposition in anterior lens capsule. Mercuria lentis is mercury deposition due to anterior lens capsule. Anterior lens capsule. Mercuria lentis due to anterior lens capsule. Anterior lens capsule. Now, sir, what I have done? I have written mercury as Hg. Hg is the symbol for mercury. Hg is a symbol for mercury. Symbol for mercury. Hg is a symbol for mercury. Hg is symbol for mercury. Now you can see how to remember. Hg is symbol for mercury. So what we are doing, see this one, Hg. So we can remember some important things by trick only. See, H for mercury has a tremor which is known as Hatter's tremor. Hatter's tremor. G for it is a glass blower tremor. Hatter's tremor and glass blower tremor. It is also known as Danbury tremor. Danbury tremor. H for Hatter's tremor, very simple trick. G for glass blower tremor. It is also known as Danbury tremor. Chronic mercury poisoning, again see Hg, it is known as hydrargyrism. Chronic mercury poisoning is known as Hg, that is hydrargyrism. So what is a simple trick? H for Hatters, G for glass blower, Hg is hydrargyrism, is a chronic poisoning by mercury. Now sir, just make a very simple trick table, TABLE table. T for we have a tremor in mercury poisoning. A for there is a disease which is known as acrodynia. Sir, acrodynia is a pink disease seen in mercury poisoning. B for brown malt reflex is seen in eye. B for brown malt reflex is seen in eye. B for ball is an antidote. L for lens, it is deposition. And E for erethism. Doctor, erethism is a psychiatric problem seen in mercury poisoning. The person becomes shy and depressed. The person becomes shy and depressed. Now, sir, write down some tricks, mnemonics. Okay, sir, what are the name of tremors seen in mercury poisoning? Asterixis in phosphorus poisoning. What are the tremors seen in mercury poisoning? What are the name of Hg? H for Hatter's shape. G for glass blower tremor. G for glass blower tremor. It is also known as Danbury tremor. What is another name of pink disease seen in mercury poisoning? Pink disease. Acrodynia. What is the antidote for mercury? Ball. Table से आपको याद रखना ball. Which part of the lens it is deposited mercury? Anterior lens capsule or posterior lens capsule? Anterior lens capsule. Which reflex is seen in eye? Which reflex is seen in eye? Brown malt reflex. Psychiatric problem in mercury is known as erethism. Mercurial erethism. The person becomes shy and depressed. Okay. Chronic mercury poisoning is known as hydrargyrism. Hg again see. Lead, sir. Lead is Pb. Chronic lead poisoning is known as plumbism. Now symptom will start with A. A for anemia and amenorrhea. Symptom will start with A. A for chronic lead poisoning is known as plumbism. Pb for plumbism. Symptom will start with A. A for anemia and amenorrhea. B for blue dot in RBC. Doctor, this question comes in exam. Blue dot in RBC, this is known as B for basophilic stippling. B for blue line in gums, this is known as Burtonian line. Again, I am telling you, A for anemia and amenorrhea. B for blue dot in RBC is known as basophilic stippling. And blue line in gums is known as Burtonian line. A done, B done. C for colic and constipation. C for colic. D for dry belly ache. D for dry belly ache and drop. Drop is a wrist drop and foot drop. D for dry belly ache and drop because of involvement of nerve, wrist drop and foot drop. E for EDTA is an antidote, and E for encephalopathy is common in children. Again, I am revising all the point. Anemia, amenorrhea, Burtonian line, basophilic stippling in RBC, Burtonian line on gums, blue line, colic, dry belly ache and drop, wrist drop and foot drop. EDTA is an antidote. Encephalopathy is seen in children. This question comes, encephalopathy is seen in children. F for face become pale. Doctor, facial pallor is earliest and most consistent symptom. facial pallor is earliest and most consistent symptom. Earliest and most consistent symptom is facial pallor. Facial face become pale because of anemia. Now, sir, most common route of lead intoxication is inhalation. Most common route is inhalation. Sindoor, Dr. Sahab, Sindoor contain lead tetraoxide. Sindoor contain lead tetraoxide. Lead tetraoxide. There is one antidote which is known as succimer. EDTA is a main antidote. Another antidote is succimer. Succimer is also known as DMSA DMSA. In lead poisoning, metaphysis become opaque. In lead poisoning, metaphysis become opaque. Metaphysis become opaque. Dr. Saab, chronic lead poisoning is also known as saturanism. Chronic lead poisoning is also known as saturanism. It is also known as plumbism. चलो मेरे साथ रिवाइज करो. Lead line on gums are known as which line? Lead line, blue line on gums are known as which line? Write down. It is Burtonian line. Chronic lead poisoning is known as two terms. One is plumbism, another is saturanism. Which is the earliest sign of plumbism? Which is the earliest sign of plumbism? Answer. Yes, facial pallor. Sindoor contain which salt of lead? Which salt of lead? Sindoor. Lead tetraoxide. Lead tetraoxide. What is the antidote of lead? EDTA is an antidote for lead. Another antidote for lead is succimer. Succimer. What is the most common route of lead poisoning? Inhalation. Sir, now I am coming to ethanol. Sir, if male and female are consuming same amount of alcohol, concentration of alcohol will be high in female. If male and female are consuming same amount of alcohol, 20 to 30% high concentration will be seen in female. Why? Because in female, metabolizing enzyme is less. In female, metabolizing enzyme is less. That's why concentration of ethanol or alcohol will be more in female. Absolute alcohol contain 99.95% ethanol. Absolute alcohol contain 99.95% ethanol. Rectified spirit contain 90% ethanol, and denatured spirit contain 95% ethanol. Absolute alcohol contain 99.5% ethanol. Rectified spirit contain 90% ethanol. Denatured spirit contain 95% ethanol. Dr. Saab, if in blood you have 80 milligram percentage of ethanol, you have nystagmus. 80 milligram percentage of ethanol, symptom is nystagmus. 150 milligram percentage of ethanol, motor incoordination. Motor incoordination. 80 milligram percentage, you have nystagmus. 150 milligram percentage, you have motor incoordination. At 400 milligram percentage, you have coma and death. And Dr. Saab, in coma and death, we have a classical sign which is known as Mac-Evan sign. Which we have a classical sign which is known as Mac-Evan sign. Mac-Evan sign. Classical sign is known as Mac-Evan sign. So 400 milligram percentage, you have coma and death. Driving limit in India, that is 30 milligram percentage. Doctor, when you are driving, your alcohol should not be more than 30 milligram percentage in India. Driving limit is 30 milligram percentage in India. Driving limit is 30 milligram percentage. Doctor Sahab, after consuming alcohol, you are misconducting with anyone. There is a IPC which is known as 510 IPC. I already told you. For ethanol, we use a formula that is known as Widmark formula. For ethanol, we use a formula that is Widmark formula. There are some tests for ethanol. These tests are KBC, कौन बनेगा करोड़पति. केबीसी कौन बनेगा करोड़पति? These are K for Kozelka and Heine test, B for bread analyzer test, C for Cavett test, C for Cavett test, and C for chromatography. 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 These are the method which are known as test for ethanol. K for Kozelka and Heine test. Yes. Yes. B for breath analyzer. Sir, breath analyzer is also known as drunkometer. Breath analyzer is also known as drunkometer. Drunkometer. In this, we use infrared test. Best test is chromatography. Best test is chromatography. नहीं, ऊपर से जा रहा है तो मैं आरिश मलिक, लिसन, इसमें इसमें ऊपर से जा रहा है क्या? इसमें तो कुछ मतलब समझाने का है ही नहीं। ओ आरिश भाई, इसमें तो समझाने का है ही नहीं, जो है वो लिखा हुआ है। इसमें ऊपर से जा रहा है ना, तो इसमें थोड़ा आराम से का मतलब नहीं है। इसमें तो कुछ मेरे को समझाने का कोई चीज बता दो, क्या समझाने का? चलो बताओ। इसमें इतना अल्कोहल होता है, इसमें मैं क्या समझाऊंगा? ये इसके टेस्ट है, इसमें क्या समझाऊंगा मैं? अगर समझाने का होता तो मैं आराम से पढ़ाता। टॉक्सिकोलॉजी इज ऑल अबाउट टू रिमेंबर, है ना? टॉक्सिकोलॉजी में कुछ समझाने का है ही नहीं भाई। जहां समझाने का था वहां सारा समझा दिया। अब चल मैं ऐसे बोलता हूं, कोजेल का टेस्ट के, बी ब्रेथ एनालाइजर टेस्ट, सी कैवेट टेस्ट, डी क्रोमेटोग्राफी टेस्ट। ओके, बेस्ट टेस्ट इज क्रोमेटोग्राफी। बेस्ट टेस्ट इज क्रोमेटोग्राफी। ठीक है? और धीरे बोलूं? इसमें अगर समझाने का होता तो मैं समझाता। चलो रिवाइज करो। विच इज द बेस्ट टेस्ट फॉर एल्कोहल? इथेनॉल। विच इज द बेस्ट टेस्ट फॉर इथेनॉल? बेस्ट टेस्ट फॉर इथेनॉल? एनीवन? ओके ओके बेटा भाई। Chromatography. What is the driving limit in India? Driving limit in India 30 milligram. Nystagmus is seen at what level? Nystagmus is seen at what level? अब तुम्हें सब तो आता है और तुम कह रहे हो हमें समझ में नहीं आ रहा। मोटर इनकोऑर्डिनेशन सीन एट व्हाट लेवल? अरे विच गैस इन क्रोमेटोग्राफी नहीं, गैस क्रोमेटोग्राफी नेम है, इट्स द नेम ऑफ मेथड। 150 मैकीवान साइन इज सीन एट व्हाट लेवल? मैकीवान साइन इज सीन एट व्हाट लेवल? 400 मिलीग्राम। मिसकंडक्ट आफ्टर एल्कोहल, तुम्हें सब कुछ तो आता है। विच आईपीसी? 510। Denatured spirit contain how much alcohol? Denatured spirit 95%. Rectified spirit 90%. What is the name of formula used for alcohol? Widmark formula. Widmark formula. ओके। केबीसी कौन बनेगा करोड़पति? इनमें कुछ भी समझाने का नहीं है भाई। समझाने का होता तो मैं हर चीज समझाता। समझाने का हुआ ही नहीं ना, समस्या तो यही है ना। मेथेनॉल, fatal dose of methanol is 80 to 120 ml. Fatal dose of methanol is 80 to 120 ml. अब एक ही चीज को मैं 5 बार बोल दूं तो बात अलग है। Fatal dose of methanol is 80 to 120 ml. Fatal dose of methanol is 80 to 120 ml. 3 बार बोलता हूं तो शायद हो सकता है तुम्हें कम लग रहा होगा। अब क्या करूं इसमें? fatal dose of methanol is 80 to 120 ml. Okay, methanol in your body forms formic acid. It forms formic acid. Formic acid attacks on retina. In retina, it causes snow-filled vision. Formic acid attacks on retina. It causes snow-filled vision. Snow-filled vision. Treatment of choice. Snow-filled vision is seen in methanol poisoning. Treatment of choice for methanol poisoning is hemodialysis. Hemodialysis. Treatment of choice is hemodialysis. Antidote of choice is ethanol. Another antidote for methanol is fomepizole. Another antidote for methanol is fomepizole. Fomepizole inhibits alcohol dehydrogenase. Fomepizole inhibits alcohol dehydrogenase. तो चलो लिखो सर, which kind of vision is seen in methanol poisoning? Which kind of vision is seen in methanol poisoning? Vision, नाम बताओ vision का. Snow-filled vision. What is the antidote of choice for methanol poisoning? Antidote of choice. Yes. It is ethanol. Treatment of choice for methanol poisoning. Treatment of choice for methanol poisoning. Hemodialysis. Hemodialysis. Fatal dose of methanol poisoning. Fatal dose of methanol poisoning 80 to 120 ml. इतना ही याद रखना. Dr. Sir, we have discussed ethanol and methanol. What is the driving limit of ethanol? Ethanol का driving limit कितना शराब का आपका? 30 ml नहीं, 30 ml नहीं, 30 milligram percentage. 30 milligram, ml नहीं, it's not ml, it is milligram percentage. Nystagmus is seen at what level? 80 milligram percentage. What is best test for ethanol? Ethanol के लिए सबसे अच्छा टेस्ट कौन सा है? गैस क्रोमेटोग्राफी. वेरी गुड. और धीरे पढ़ाऊं, और इससे भी धीरे. ड्राई वाइन इज क्लोरल हाइड्रेट. ड्राई वाइन इज क्लोरल हाइड्रेट. मैं तो और धीरे पढ़ाता हूं, तुम्हारा 8 बजे तक चलेगा. ओके, बहुत धीरे धीरे. ड्राई वाइन इज क्लोरल हाइड्रेट. क्लोरल हाइड्रेट. क्लोरल हाइड्रेट. ड्राई वाइन इज क्लोरल हाइड्रेट. जब तक तुम्हें याद नहीं हो जाता तब तक पढ़ाता हूं, ठीक है? हाँ, मिथेनॉल वाला एमएल में अभी बहुत है भैया. अभी कम से कम 7:30 तक चलेगा. अगर ऐसा चला तो 8:30 तक चलेगा, 8:30 तक. ड्राई वाइन इज क्लोरल हाइड्रेट. इट इज ऑल्सो नॉन एज नॉकआउट ड्रॉप्स. It is also known as knockout drops. Knockout drops. And it is also known as Mickey Finn. Mickey Finn. Dry wine is chloral hydrate. It is also known as 1.8 speed grow. Dry wine is chloral hydrate. It is also known as knockout drops. It is also known as Mickey Finn. ओके, ड्राई वाइन हो गया ना काम. चलो सर आगे चलते हैं. इफ एनी पॉइजनिंग केस कम्स टू ए डॉक्टर, first duty of a doctor is to start the treatment. Second duty of a doctor is to inform the police. Dry wine is a chloral hydrate, Mickey Finn, and knockout drops. This is name of dry wine. First duty of a doctor is to start the treatment. Second duty of a doctor is to inform the police. Information to the police is 39 CRPC. Information to the police is 39 CRPC. If you have If you have oral poison, if you have oral poison, you should go for gastric lavas. Gastric lavas. For gastric lavas, we use a tube that is known as Ewald tube. For gastric lavas, we use a tube that is known as Ewald tube. In gastric lavas, we use KMNO4 at 1:5,000 concentration. We use gastric lavas for oral poison. We insert a tube that is known as Ewald tube. KMNO4 is used in gastric lavas. KMNO4, yes. KMNO4 is used as 1:5,000 concentration. Contraindication of gastric lavas. Contraindication of gastric lavas. और धीरे पढ़ाऊंगे भाई. Contraindication of gastric lavas is first is corrosive. Corrosive. So what happens in corrosive? In corrosive, mucosa become thin. Corrosive mucosa become thin. There are chances of perforation. There are chances of perforation. Second contraindication of gastric lavas is kerosene. In kerosene, there are chances of aspiration. In kerosene, there are chances of aspiration. But in corrosive, there are chances of perforation. But sir, there is one corrosive. This is one corrosive in which gastric lavas is done. That is exception. This is carbolic acid. In carbolic acid, gastric lavas is done because in carbolic acid, leathery mucosa is seen. No chances of perforation. We have leathery mucosa in carbolic acid. We have leathery mucosa in carbolic acid. चलो डॉक्टर साहब मेरे साथ रिवाइज करो. What is the name of tube for gastric lavas? Tube का नाम क्या है? What is the name of tube for gastric lavas? Let me see. Ewald tube. Ewald tube. In which gastric lavas is contraindicated? One, which poison? Corrosive. Another which poison? Another which poison? Kerosene. Okay. Which poison gastric lavas can be done? Which corrosive gastric lavas can be done? Which poison? Likho carbolic acid. Why gastric lavas is done in carbolic acid? Mucosa is normal or leathery? Normal or leathery? Leathery mucosa. What is doctor's first duty? Start the treatment or inform the police? Start the treatment or inform the police? Information to police comes under which CRPC? Which CRPC? Yes. This is 13. Who is this Dr. Adil? Dr. Adil कौन है भैया?
सर मैंने दूसरे आईडी में उसमें खोली हुई है. रजाक सर रजाक.
रजाक है क्या? मैंने कहा ये डॉक्टर आदिल कहाँ से आ गया? ठीक है. ओके. तो 39 CRPC. वेरी गुड. ड्राई वाइन. ड्राई वाइन के 3 नाम बताओ. व्हाट आर द 3 नेम्स ऑफ ड्राई वाइन? Chloral hydrate, Mikifin, and knockout drops. Chloral hydrate, Mikifin, and knockout drops. Okay. Now, sir, in treatment, we also use charcoal. In treatment, we also use charcoal. Charcoal is a black powder. It absorbs the poison. This is a black powder. It absorbs the poison. Absorb on surface. It is absorption of the poison. Charcoal is an example of physical or mechanical antidote. Charcoal is an example of physical or mechanical antidote. Dose of charcoal is 50 to 100 gram. Dose of charcoal is 50 to 100 gram or 1 gram per kilogram body weight. 50 to 100 gram or 1 gram per kilogram body weight. डॉक्टर साहब मेरे को रिवाइज करो, चारकोल का मैकेनिज्म क्या है, एब्जॉर्प्शन या एड्सॉर्प्शन? राइट डाउन, एब्जॉर्प्शन और एड्सॉर्प्शन. ओके, लेट मी सी. It is adsorption. It is an example of which antidote? Physical or physiological? Physical or physiological? Yes, it is a physical antidote. What is a dose of charcoal in kilogram per gram per kilogram? What is a dose of charcoal in gram per kilogram? It is 1 gram per kilogram. It is 1 gram per kilogram. Very good. This is charcoal. Now, sir, this question comes, what is universal antidote? Sir, universal antidote has 3 parts, M, T, C. M for magnesium oxide, M for magnesium oxide, T for tannic acid. You can see M for magnesium oxide, T for tannic acid, C for charcoal. Magnesium oxide 1 part, tannic acid 1 part, charcoal 2 part. This is known as universal antidote. Again, I am revising: magnesium oxide, tannic acid and charcoal. Magnesium oxide 1 part, tannic acid 1 part, charcoal 2 part. Magnesium oxide 1 part, tannic acid 1 part, charcoal 2 part. This combination is known as universal antidote. This combination is known as universal antidote, MTC. Magnesium oxide, tannic acid, charcoal. 1, 1, 2. Doctor Saab, for alcohol and opium poison, we use coma cocktail because in both we go to coma. Sir, coma cocktail combination is DNB1. DNB1. जब आप DNB का एग्जाम पहली बार दोगे, you will go in coma. That's a very simple trick. Coma cocktail composition is DNB1. D for dextrose, N for naloxone, B for B1, vitamin B1, that is thiamine. So dextrose, naloxone is 2 milligram and vitamin B1, thiamine. This combination is known as coma cocktail. You can remember by DNB1. DNB का एग्जाम आप पहली बार दोगे, you will go in coma. It is used in alcohol and opium poisoning. Alcohol and opium poisoning. सर यहाँ FMG वाले हैं, कोमा में चले गए थे. ओके, डॉक्टर साहब मेरे साथ रिवाइज करना. मैग्नीशियम ऑक्साइड, टैनिक एसिड एंड चारकोल फॉर्म्स विच एंटीडोट? Which antidote? Which antidote? Let me get your answer. Okay. Universal antidote. It is universal antidote. Coma cocktail contain what? Coma cocktail contain what? DNB1. What is DNB1? D for dextrose. Yes. N for naloxone. B1 for vitamin B1 used in opium and alcohol. Sir, for metallic poison, we use chelating agent. For metallic poison, we use chelating agent. Doctor, first chelating agent is BAL. BAL is British anti-leucite. BAL is British anti-leucite. Doctor, it is given as intramuscular injection. IM means intramuscular injection. It is contraindicated in cadmium and iron. It is contraindicated in cadmium and iron. This is BAL, British anti-leucite, first chelating agent. It is contraindicated in cadmium and iron. Penicillamine is given in copper and it is contraindicated in arsenic. Penicillamine is a chelating agent given in copper. It is contraindicated in arsenic. EDTA, actually same, almost same name, lead. It is given in lead. It is contraindicated in mercury. EDLA, LEAD, lead. It is given in lead. So, sir, you can get a question. What you can get a question? Write down. BAL is contraindicated in which poison? Write down. BAL is contraindicated in which poison? Write down. Cadmium and iron. Penicillamine is contraindicated in which poison? Yes, it is contraindicated in arsenic, given in copper. EDTA is given in lead and contraindicated in. EDTA is contraindicated in Yes, mercury. EDTA is contraindicated in mercury. क्या मैं कहाँ से लूंगा यार, कितने बजे करेंगे? अभी बोल दिया मैंने, करो। अच्छा, okay. Hemodialysis is contraindicated in hemodialysis is a treatment. It is contraindicated in KBC. KBC. These are the poison in which hemodialysis is never done. K for kerosene. K for kerosene. Yes. For iron, you can write down one more. For iron, we use desferoxamine. For iron, we use another chelating agent, that is desferoxamine. Desferoxamine. And even it is used for radioactive heavy material. Desferoxamine for iron. Now, talks of hemodialysis is contraindicated in KBC. K for kerosene, B for benzodiazepine, C for copper sulfate and chloroquine, and hero for heroin. You can remember KBC hero. KBC hero. Hemodialysis is contraindicated in kerosene, benzodiazepine, copper sulfate and chloroquine, and heroin. Hero for heroin. Heroin. चलो डॉक्टर साहब लिखो. Penicillamine is contraindicated in. Penicillamine is contraindicated in. Anyone? Arsenic. Arsenic. EDTA is contraindicated in. EDTA. Mercury. Desferoxamine is used in. Iron. Yes. Hemodialysis is contraindicated in. What is a mnemonic? What is a trick to remember? Hemodialysis is contraindicated in. KBC. K for kerosene. B for benzodiazepine. BZD. Benzodiazepine. Copper sulfate, chloroquine. C.
सर ये आयरन वाला क्वेश्चन था 31 अगस्त को.
अच्छा, इस बार था क्या आयरन वाला?
हाँ सर.
यही क्वेश्चन था क्या कि डेस्परोक्सामिन किस में यूज किया जाता है?
हाँ सर.
ओके, चलो कोई बात नहीं. Poisoning cases, if we are conducting postmortem of poisoning cases, we go for toxicological analysis or chemical analysis. Toxicological analysis or chemical analysis. Now, Dr. Saab, what do we use as a sample and what are the preservative used for toxicological analysis? If we are using blood sample, preservative is sodium fluoride. If we are using blood sample, preservative is sodium fluoride. Blood sample, preservative is sodium fluoride. If we are using urine sample, preservative is thymol. Urine sample, preservative is thymol. Blood sample, preservative is sodium fluoride. Solid organ like stomach, intestine, liver, kidney, brain, which are known as viscera, preservative ideal is rectified spirit, or sometimes we use common salt. Sometimes we use common salt. Likho chalo, what is a preservative for blood? What is a preservative for blood? Likho, sodium fluoride. What is a preservative for urine? What is a preservative for urine? Yes, it is thymol. What is a preservative for all viscera? All viscera. Rectified spirit is the best preservative, or sometimes we use common salt. All stomach, intestine, liver, kidney, we use, yes friends, we use rectified spirit is best, and otherwise we use common salt. For histopathology, yes, for histopathology, best preservative is formalin. चलो बताओ, what is a preservative for blood sample? in toxicology analysis? बोलो 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 बोलो. केक खा लिया. Sodium chloride. Okay, very good. What is the preservative for urine? Okay, very good. That's thymol. What is the preservative for all solid organ? Viscera. Viscera. It is rectified spirit and sodium chloride. For histopathology, yes, done. For histopathology, we do formalin. We took preservative, that is formalin. For virology of organ, we get preservative, that is glycerin. Glycerin. Histopathology, we use formalin. For virology, we use glycerin. For heavy metals, which is the best site? Bone is the best site for heavy metals. Bone is the best site for heavy metals. For organophosphorus, brain is the best site if you want to preserve. Sometimes you get a question, sir, which is the best site for which poison? For heavy metals like arsenic, thallium, bone is the best site. For organophosphorus, brain is the best site. For cyanide, spleen is the best site. For cyanide, spleen is the best site. For gaseous poison, lung are the best site. These are some very important MCQ. For heavy metal, bone is the best site. For organophosphorus, brain is the best site. For cyanide, spleen is the best site. For gas, lung is the best site. For gas, lung is the best site. Heavy metals, bone, organophosphorus, brain, cyanide, spleen, gas, lung. Now, sir, see which is ideal homicidal poison. Which is ideal homicidal poison? Sir, ideal homicidal poison is thallium. If you want to kill someone, if you have thallium, that is the best poison to kill. But sir, which is most commonly used poison? We have two A. Two important A. A for arsenic, A for aconite. A for arsenic, A for aconite. Sir, aconite is known as meetha zahar. Aconite is known as meetha zahar. It is another name is meetha zahar. Sir, it is a cardiac poison. Aconite is a cardiac poison. Aconite is also known as meetha zahar. It is a cardiac poison. And Dr. Sahab, this question comes in exam. Aconite also known as blue rocket. Aconite also known as blue rocket. There is a classical sign which is known as Hippus sign. There is a classical sign which is known as Hippus sign. What is Hippus sign? Hippus sign is alternate contraction and dilation of pupil. Hippus sign is alternate contraction and dilation of pupil. चलो मेरे साथ रिवाइज करो. Which is the best sample to be preserved for cyanide poisoning? Best site to be preserved for cyanide poisoning? Anyone? Cyanide के लिए best site कौन सी है? Spleen. Best organ is spleen. Best organ for organophosphorus? सुना गेट बंद कर देना मेरा. Best organ for organophosphorus? Brain. Best organ for heavy metals? Heavy metals, bone. Hippus sign is positive in which poisoning? Hippus sign is positive in which poisoning? Aconite. Aconite is also known as blue rocket. It's a cardiac poison. Which is an ideal homicidal poison? Ideal homicidal poison. Homicidal, if you want to kill someone. Thallium is the ideal homicidal poison. Arsenic is most commonly used. Now we'll discuss arsenic. Now we'll discuss arsenic. A for abortion, A for Dr. Sahab, Eldridge-Mees line. In arsenic poisoning on nail, you have line which is known as Eldridge-Mees line. Eldridge-Mees line. A for abortion, A for Eldridge-Mees line. R for red velvety mucosa, Randrop pigmentation, and Rinch test. A for abortion, arsenic causes abortion. A for nail has Eldridge-Mees line. R for red velvety mucosa, raindrop pigmentation and rinse test. Some old question comes in exam. Red velvety mucosa, raindrop pigmentation and rinse test. As for subendocardial hemorrhage, as for subendocardial hemorrhage, if E for excessive hyperpigmentation of palm and sole, E for excessive hyperpigmentation of palm and sole, N for neuropathy, it is sensory motor neuropathy, sensory motor neuropathy. I for iron oxide is an antidote, but sir, BAL is a better antidote. BAL is more commonly used. C for it mimics cholera. So again, I'm revising. Eldritch Mees line, red velvety mucosa, raindrop pigmentation, rinse test, subendocardial hemorrhage, excessive hyperpigmentation of palm and sole, neuropathy, sensory motor neuropathy. Iron oxide is an antidote. Better antidote is BAL. Better antidote is BAL. Arsenic mimics a poisoning, that is cholera. That is cholera. Now, sir, we have to write down few important G. Arsenic mimics a disease, that is cholera. Now, arsenic is done ARR, red velvety, raindrop pigmentation, neuropathy, iron oxide is an antidote. It mimics cholera. C. Now, three important G. Arsenic G. Respect karo arsenic. G for Gurjet test, which is the best test for arsenic. G for arsenic give garlicky smell, and G for golden hair. Golden hair are seen in arsenic poisoning. G for Gurjet test is the best test. G for garlicky smell. G for golden hair in arsenic poisoning. Golden hair in arsenic poisoning. Fatal dose. Sir, fatal dose of arsenic is 100 to 200 milligram. 100 to 200 milligram. In acute poisoning, arsenic goes to the liver. In chronic poisoning, arsenic goes to the bone. In acute poisoning, arsenic goes to the liver. In chronic poisoning, arsenic goes to the bone. And Aksar, skin, nail, and hair are also very good sample of arsenic. Skin, nail, and hair are also very good sample for arsenic. Arsenic causes a disease which is known as black foot disease. Arsenic causes a disease which is known as black foot disease. Chalo, MCQ पूछता हूँ. What is a type of mucosa seen in arsenic poisoning? Mucosa seen in arsenic poisoning. What's the name of that mucosa? Stomach mucosa. Red velvety. ये question आता. What kind of pigmentation is seen in arsenic poisoning? Which kind of pigmentation seen in arsenic poisoning? Raindrop. Arsenic mimics a disease. What's the name of disease? It look like a disease. Cholera. What are the name of lines? What are the name of lines? Mees line. Mees line. Mees line. What is a fatal dose of arsenic? What is a fatal dose of arsenic? 100 to 200 milligram. Arsenic causes a disease. What is the name of that disease? Arsenic causes a disease. What is the name of disease? Black foot disease. Black foot disease. Garlic smell is seen. Golden hair are seen. Gurjet test is the best test. Gurjet test is the best test. Now, sir, ideal suicidal poison. Now, sir, ideal suicidal poison. Sir, ideal suicidal poison is cyanide. Cyanide. C for cyanide. C for it inhibits cytochrome oxidase. C for cyanide. C for it inhibits cytochrome oxidase. Now, sir, if we remember C, we can remember A and B also. Amyl nitrite is an antidote for cyanide. Amyl nitrite is an antidote for cyanide. Vitamin B12 is also an antidote for cyanide, but amyl nitrite is a better antidote. B for bitter almond smell. So how to remember? C for cyanide, C for inhibit cytochrome oxidase, A for amyl nitrite is an antidote, B for B12. Vitamin B12 is also an antidote, but sir, remember bitter almond smell. Bitter almond smell is seen in cyanide. Bitter almond smell. A, B, C. A for amyl nitrite is antidote. B for vitamin B12 is antidote. B for bitter almond smell is seen. C for cyanide inhibit cytochrome oxidase. Cyanide inhibit cytochrome oxidase. Now, sir, in cyanide we use sodium thiosulfate, which excrete urine. Cyanide come out because of sodium thiosulfate. Sodium thiosulfate. Cyanide is also known as prussic acid. Cyanide is also known as prussic acid. Chalo sir, write down. Cyanide inhibits which enzyme? Cyanide inhibits which enzyme? Write down. Okay. Cytochrome oxidase. Which kind of smell is seen in cyanide? कौन सी स्मेल देखी जाती है साइनाइड में? Bitter almond smell. Bitter almond smell. What is the antidote of choice for cyanide? What is the antidote of choice for cyanide? Amyl nitrite. Which salt is used for secretion of cyanide from urine? Salt which is used for secretion of cyanide from urine? Sodium thiosulfate. Sodium thiosulfate. Cyanide is also known as which acid? Prussic acid. Cyanide is also known as prussic acid. Prussic acid. Yes, my dear friend. This is also known as prussic acid. Prussic acid. Chalo sir, this is ideal suicidal poison. This is cyanide. Cyanide is ideal suicidal poison. Now I am coming to most commonly used suicidal poison is insecticide. Most commonly used suicidal poison is insecticide. In insecticide, first we use organophosphorus. First we use organophosphorus. Second we use sulfose. Organophosphorus is the most commonly used. Second we use sulfose. So sulfose is Al-P3, aluminium phosphide. What happens, sir? This Al-P3 in your body forms PH3. This Al-P3 in your body forms PH3. This Al-P3 in your body forms PH3. 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 So, Dr. Sulfose inhibits cytochrome oxidase. What is sulfose? Sulfose is Al-P3, aluminium phosphide. Aluminium phosphide. In your body, it forms PH3. In your body, it forms PH3, phosphine, PH3. PH3 inhibits cytochrome oxidase. So sulfose inhibits cytochrome oxidase. So one thing is clear, sir. It contain phosphorus. So one thing is clear, sir. It is garlicky smell. It is showing you garlicky smell. Garlicky smell is seen. Now, sir, fatal dose. This question comes in exam. Fatal dose of sulfose is 1 to 2 tablet and 0.2 to 0.5 gram. Fatal dose of sulfose is 1 to 2 tablet and 0.2 to 0.5 gram. 0.2 to 0.5 gram. चलो सर, क्वेश्चन पूछता हूं. Cyanide inhibits which enzyme? Cyanide inhibits which enzyme? Cytochrome oxidase. Sulfose inhibits which enzyme? Sulfose inhibits which enzyme? Yes, cytochrome oxidase. What is a fatal dose of sulfose in tablet? What is a fatal dose of sulfose in tablet? How many tablets? Yes, 1 to 2 tablets. 1 to 2 tablet. Which vitamin is used in the treatment of cyanide? Which vitamin? Vitamin B12. Vitamin B12. Which kind of smell is present in cyanide? कौन सी smell आती है? Bitter almond smell. Bitter almond smell. Sulfose give which smell? Sulfose smell Yes, it is garlicky smell because it contains phosphorus. Because it contains phosphorus. But sir, now I am coming to very important poison which contain phosphorus but smell is not garlicky. Sir, it is organophosphorus which give kerosene like smell. Organophosphorus which gives kerosene like smell. This is a very important MCQ, my dear friend. Organophosphorus give kerosene like smell. Organophosphorus give kerosene like smell. Kerosene like smell. लिखना, black foot disease is caused by, black foot disease is caused by arsenic. Hila Rabba, absolutely right. Arsenic. Okay. Organophosphorus give kerosene like smell. Now, Dr. Sahab, organophosphorus is of two type, alkyl phosphate and aryl phosphate. Two type of organophosphorus we have, alkyl and aryl. Sir, alkyl is malathione. This is a very important MCQ. Alkyl is malathione. You can remember by malaika. That's a very simple trick. Malaika, malika. Mala means mala, alkyl. That is malaika, alkyl. Aryl phosphate are parathione and digenone. Parathione is also known as polydol. Digenone is TIC20. Malathione is a bug killer. Parathione is a polydol. Digenone is TIC20. Digenone is TIC20. So, Dr. Sahab, which is a alkyl phosphate? Which is a alkyl phosphate? Which is a alkyl phosphate? Malathione is a alkyl phosphate. Aryl phosphate are parathione and digenone. Parathione in market is known as polydol. Digenone is known as TIC20. Digenone is known as TIC20. TIC20. Now, sir, see. Another important word. Mechanism of action. It irreversibly inhibits acetylcholinesterase. It irreversibly inhibits acetylcholinesterase. Some mechanism of action, it irreversibly inhibits acetylcholinesterase. So effect will be cholinergic. Effect will be cholinergic. All effect will be cholinergic because it inhibits acetylcholinesterase. All effect will be cholinergic. What are the effects? If you see, effect are BSC. B for bradycardia. B for bradycardia. S for secretions are increased. S for secretions are increased. Bradycardia. Secretions are increased. Secretions are increased. Bradycardia. Secretions are increased. And the last one is constriction of pupil. Constriction of pupil. So again, I'm revising, my dear friend, all the points. Okay, so this is, we are having two type of this. अब तो स्क्रीन दिख रही है ना? Kerosene like smell is seen. It irreversibly inhibits acetylcholinesterase. It irreversibly inhibits acetylcholinesterase. Done. The symptoms are bradycardia, B for bradycardia. S for secretion are increased. Secretions are increased. And doctor, because secretion are increased, we have a red tear. Your tear become red. And C for constriction of pupil. This is known as meiosis. These are cholinergic effect. These are cholinergic effect. डॉक्टर मेरे साथ रिवाइज करना. Kerosene like smell is seen in which poison? Kerosene like smell is seen in which poison? Let me get your answer. Kerosene like smell is seen in which poison? Organophosphorus. Which organophosphorus is alkyl group? Having alkyl group. Which organophosphorus having alkyl group? Malathion. Folidol is another name of. Folidol is another name of. Folidol is another name of parathion. TIC20 is another name of. TIC20 is another name of digenone. Digenone. Sir, here we have cholinergic effect because of inhibition of irreversible inhibition of acetylcholinesterase. BSC, bradycardia. Secretion are increased. Because of increased secretion, we have red tear, constriction of pupil. Investigation of choice is RBC cholinesterase. This question comes in exam, my dear friend. Investigation of choice is RBC cholinesterase. RBC cholinesterase. Antidote. Sir, for antidote, we use two things. One is atropine. Atropine inhibits central and muscarinic effect. Atropine inhibits central and muscarinic effect. Pralidoxime inhibit nicotinic effect. Pralidoxime inhibit nicotinic effect. Atropine inhibits central and muscarinic effect. Pralidoxime inhibit nicotinic effect. Nicotinic effect. तो मेरे साथ रिवाइज करना. What is the investigation of choice, my dear friend? What is the investigation of choice for organophosphorus poisoning? Investigation of choice for organophosphorus poisoning. RBC cholinesterase. Which color tear are seen in organophosphorus poisoning? Which color tear are seen in organophosphorus poisoning? Red tear. Now, a very important word, sir. Very, very important word. Atropine inhibits which effect pharmacologically? Which effect? Atropine inhibits which effect? Muscarinic and central effect. Atropine inhibits muscarinic and central effect. And nicotine, pralidoxime inhibit what, my dear friend? Pralidoxime inhibit what? Yes, it is. Pralidoxime inhibit. Yes, friends. Nicotinic effect. Now, next one. Now, sir, andrine. Another insecticide is andrine. Sir, andrine is organochlorine. Andrine is organochlorine. Andrine is also known as plant penicillin. Andrine is also known as plant penicillin. So you can get a question, sir. Plant penicillin is another name of andrine. Plant penicillin is another name of andrine. Another name of andrine. Now, sir, cardiac poison, which attack on heart, we can remember by a very simple trick. Dawn has a queen. Dawn has a queen. These are the cardiac poison. You can remember D for digitalis, O for oleander, N for nicotina tabacum, H for hydrocyanic acid, A for aconite, and queen for quinine. Dawn has a queen. Digitalis, oleander, nicotina tabacum, tobacco, hydrocyanic acid, aconite, and quinine. These are the cardiac poisons. Sir, oleander, in Hindi, it is known as kaner. Oleander, in Hindi, it is known as kaner. It is of two types, white oleander and yellow oleander. It is of two types, white oleander and yellow oleander. White oleander is known as Nerium odorum and yellow oleander is known as Cerebra thivacea. White oleander is also known as Nerium odorum, and yellow oleander is known as Cerebra thivacea. Now, Dr. I am putting one question. Nerine is a principle of, nerine is a principle of white oleander or yellow oleander? Write down. Nerine is a principle of, yes sir, white oleander. Cerebrine is a principle of, Cerebrine is a principle of yellow oleander. ये क्वेश्चन आता है. These toxins are nerine and cerebrine. Nerine is a principle of white oleander. Cerebrine is a principle of yellow oleander. Now, sir, next poison is copper. Sir, C for copper, C for kleptone line. C for copper, C for kleptone line. Kleptone line are blue-green line on gums. Kleptone line are blue-green line on gums. Dr. Saab, copper poisoning causes increased salivation, and Dr. Saab, increased salivation is known as tylism. Increased salivation is known as tylism. Tylism. Copper poisoning also causes vineyard sprayer lung disease. Copper poisoning also causes vineyard sprayer lung disease, and copper also causes Wilson disease. So, Dr. Saab, आपको ये सब याद रखना है. You can get a question. I am putting a question. Write down. Nerine is a principle of. Nerine is a principle of white oleander or yellow oleander? Nerine, white. Cerebrine is a principle of yellow oleander. Vineyard sprayer lung disease is caused by. Vineyard sprayer lung disease is caused by copper intoxication. What are the gum lines seen in copper poisoning? Gum line seen in copper poisoning. What is the name of bluish green line? What is the name of this line? What is the name of this line? Kleptone line. Yes, friends, it is kleptone lines. Yes, friends, it is kleptone line. Kleptone lines. Now, sir, carbon monoxide poisoning. Carbon monoxide poisoning. Sir, treatment for carbon monoxide poisoning, we use hyperbaric oxygen. We use hyperbaric oxygen, and we also use one vitamin, that is vitamin E. Sir, vitamin E is tocopherol. Vitamin E is tocopherol. We use hyperbaric oxygen and vitamin E. डॉक्टर साहब, मैं आपके सामने 4 क्वेश्चन रखता हूँ. Right, I am just mentioning vitamin and you will use in which poison it is used. Okay, देखो कितना याद है आपको, अभी मालूम चल जाएगा. Vitamin B12 used in. Vitamin B12 used in. Anyone? Cyanide. Yes, Jabin, absolutely right. Cyanide. B12 used in cyanide. Absolutely right. Okay, but Damodaran, absolutely right. Vitamin B12 हो गया. Vitamin K used in. Vitamin K. इसका बताओ भाई. Vitamin K used in. K. भूल गए. Phosphorus. Yes, Nishant Cat. It is phosphorus. Phosphorus. Ilaraba is phosphorus. Vitamin B1, thiamine, coma cocktail used in. Vitamin B1, thiamine, coma cocktail used in. Coma cocktail किसमें यूज करते थे हम? कौन से पॉइजन में यूज करते थे? किसमें हम कोमा में चले जाते हैं? Alcohol and opium. Yes, Jabin, absolutely right. And vitamin E is used in. Very good, Damodar. Vitamin E is used in carbon monoxide. Yes, carbon monoxide. Absolutely right, Dr. Saab. आप सब बहुत अच्छा कर रहे हो. Dr. Saab, corrosive. Corrosive are of two types. One is acid and alkali. Alkali are more dangerous. Alkali are more dangerous. The reason is alkali causes liquefactive necrosis and acid causes coagulative necrosis. Alkali causes liquefactive necrosis, acid causes coagulative necrosis. That's why alkali are more dangerous, because liquid Dr. Saab, boric acid, first acid, boric acid. First acid is boric acid. Boric acid causes, B for boric acid, BO. It causes boiled lobster syndrome. Boric acid causes boiled lobster syndrome. BO, boiled lobster syndrome. Boric acid. Dr. Saab, मेरे साथ रिवाइज करना. Alkali causes which necrosis? Alkali causes which necrosis? Anyone? Which necrosis? Alkali? Yes. Alkali causes liquefactive necrosis. That's why there no illa acid causes coagulative necrosis. That's why alkali are more damaging. Now, दूसरा question. Boiled lobster syndrome is caused by. It's a very simple trick. Bo. Boiled lobster syndrome is caused by boric acid. Boric acid. Now, sir, second acid is nitric acid. Nitric acid is HNO3, Tejab, or aqua fortis. Nitric acid is HNO3, Tejab, or aqua fortis. Sometimes this question comes, my dear friend. Aqua fortis is another name of nitric acid. Aqua fortis is another name of nitric acid. Sir, by nitric acid, your urine and mucosa become brown color. By nitric acid, your urine and mucosa become brown color, and skin tissue, these become yellow color. This reaction is known as xanthoprotic reaction. Urine and mucosa become brown color. Urine and mucosa become brown color. Skin and tissue become yellow color. This reaction is known as xanthoprotic reaction. Xanthoprotic reaction. तो डॉक्टर साहब मेरे साथ रिवाइज करना. Boiled lobster syndrome is seen in which acid? Boiled lobster syndrome is seen in which acid? Okay. Which acid? Boric acid. Xanthoprotic reaction is seen in which acid? Xanthoprotic reaction is seen in which acid? Yes, sir. Absolutely right. It is nitric acid. Nitric acid is also known as aqua fortis. Brown color urine and mucosa is seen. Now, sir, oxalic acid. Oxalic acid is used as ink remover. Look, sir, the use of oxalic acid in market is it is used as ink remover. It is used as ink remover. If you have ink in your clothes, it is used to remove the ink. In your body, it forms calcium oxalate. In your body, it forms calcium oxalate. Calcium oxalate, and it causes hypocalcemia. Hypocalcemia, because when calcium is combined with the oxalate, free calcium will be decreased. It is hypocalcemia. Antidote, we use calcium gluconate. Antidote, we use calcium gluconate. And also for treatment, we also use chalk powder. So everything is C. C, 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 C. And color of vomiting is coffee ground vomitus, my dear friend. Color of vomiting is coffee ground vomitus. Doctor, you can see it forms calcium gluconate, calcium oxalate first. Calcium oxalate first, very simple. Second, hypocalcemia it causes. Third, very important one, my dear friend, that is calcium gluconate is antidote. Chalk powder. Doctor, even in wall scraping, your wall scraping has calcium. Sir, it is chalk powder and wall scraping are also used in treatment. And the last is coffee ground vomitus. Yes, coffee ground vomitus. Coffee ground vomitus. This is also used. This is also used. Are yes or no? Coffee ground vomitus. Doctor, wall scraping पे भी question आएगा. Wall scraping is used in which poison? The answer is yes, my dear friend. The answer is yes. Answer is oxalic acid. Now I am coming to. डॉक्टर साहब मेरे सवाल का जवाब दो. कॉफी ग्राउंड वोमिटस इज सीन इन विच पॉइजनिंग? कॉफी ग्राउंड वोमिटस इज सीन इन विच पॉइजनिंग? Which poisoning? Yes, it is oxalic acid poisoning. Wall scraping is used in which poisoning? Yes, it is oxalic acid poisoning. Boiled lobster syndrome is seen in which poisoning? Boiled lobster syndrome is seen in boric acid. Brown color mucosa and urine is seen in which poisoning? It is nitric acid. Xanthoprotic reaction is seen in which poisoning? The answer will be yes, nitric acid. Now carbolic acid, my dear friend. Sir, I have already discussed carbolic acid is the only acid in which gastric lavage is done, because in carbolic acid we have leathery mucosa. We have leathery mucosa. C for carbolic acid, C for constriction of pupil, C for carbolic acid, C for constriction of pupil, C for it is deposited in the cartilage. Doctor Sahab, Deposition of carbolic acid in cartilage is known as ochronosis. C for carbolic acid, C for constriction of pupil, yes, C for constriction of pupil, and C for cartilage deposition, and C for it causes carboluria. Carboluria. Sir, carbolic acid is also known as phenol. Carbolic acid is also known as a phenol. Phenol is an antiseptic. Look, sir, everything is C. C for carbolic acid, C for constriction of pupil, C for cartilage deposition, C for carboluria. Carboluria is green color urine. Carboluria is green color urine. It is green color urine. Dr. Saab, phenol. First two alphabet of phenol, PH. There are two metabolite of phenol. One is pyrocatechol, another is carbolic acid and phenol both are same. Carbolic acid and phenol both are same. These form two metabolite. One is pyrocatechol, another is hydroquinone. These are secreted in the urine known as carboluria. Carboluria. देखो याद करने का तरीका. इसमें we can go for gastric lavage because mucosa is leathery. Carbolic acid. Carbolic acid is also known as phenol. Cartilage deposition is known as ochronosis. Carboluria is green color urine. Why carboluria is seen? Because phenol or carbolic acid in your body forms two metabolite. Two metabolite. These two metabolite are pyrocatechol and hydroquinone. And as I told you, phenol is an antiseptic. Phenol is a antiseptic. So if person die due to phenol, decomposition will be delayed. Phenol is a antiseptic. If any person dies due to phenol या carbolic acid, decomposition will be delayed. Decomposition will be delayed. Decomposition will be delayed. Now, sir, we are coming to sulfuric acid, H2SO4. We are coming to sulfuric acid, H2SO4. H2SO4. Sir, what is sulfuric acid? Sulfuric acid is strongest acid. It is the strongest acid. It is also known as oil of vitriol. Sulfuric acid is also known as oil of vitriol. Oil of vitriol. Sulfuric acid. Oil of vitriol. Doctor, how to remember the fatal dose and fatal period? 5, 10, 15, 20. 5 to 10 ml is a fatal dose. 15 to 20 hour is a fatal period. 5 to 10 ml is a fatal dose. 15 to 20 hour is a fatal period. 5, 10, 15, 20. Doctor, BC. It causes black color mucosa and black color organ. This mucosa is known as blotting paper mucosa. This mucosa is known as blotting paper mucosa, and because of this we have chalky white teeth. Because of this we have chalky white teeth. Antidote is magnesium oxide. Antidote is magnesium oxide. Antidote is magnesium oxide. चलो डॉक्टर साहब आपसे कुछ सवाल पूछता हूँ. लिखो. Green color urine seen in which poisoning? Green color urine in which corrosive? Green color urine. Green color urine. Carbolic acid. Which acid is used as an ink remover? Which acid is used as an ink remover? Yes. It is. Yes, it is oxalic acid. Oxalic acid is used as an ink remover. Very good. Which is known as aqua fortis. Which is known as aqua fortis. Tejab. Blotting paper appearance. Blotting paper appearance is seen in which one? Which mucosa? Blotting paper appearance. Yes. It is H2SO4. H2SO4, sulfuric acid. What is the antidote for H2SO4? Antidote for H2SO4. Magnesium oxide. Very good. Magnesium oxide is antidote. Oil of vitriol is another name of. Oil of vitriol is another name of. Oil of vitriol is another name of. Okay, it is H2SO4. It is the strongest acid. Very good, my dear friend. Euchronosis is seen because of which acid? Euchronosis. Yes, it is. Euchronosis is because of carbolic acid. By which acid, if the person dies, decomposition is delayed? By which acid, if the person dies, decomposition is delayed? Anyone? Yes, friends. It is phenol or carbolic acid. Phenol or carbolic acid. Very good. चलो हुआ याद कुछ? Red velvety mucosa is seen in. Red velvety mucosa is seen in arsenic poisoning. Dr. Saab, I have already told you, throwing of acid is known as vitriolas. It is 326A and 326B IPC already discussed. 326A and 326B IPC, it is already discussed. It is acid attack. 3 लड़कों ने 2 लड़कियों पे छिड़क दिया एसिड, 3 लड़कों ने 2 पे छिड़का, बच गई. डॉक्टर साहब, for vitriolas we also use some plant juice. Plant juice are also used. These plant juice are SC. What is SC? Semicarpus anacardium. Semicarpus anacardium, that is a marking nut. This is most commonly used. And C is calotropis, doctor, but this is more commonly used. These plant juice are also used for vitriolas. As for Semicarpus anacardium, C for calotropis. C for calotropis. Semicarpus anacardium and calotropis. Yes. Calotropis. Semicarpus anacardium and calotropis. Calotropis. Okay, SC. Vitriolas, 326A, 326B. Now, Dr. Sir, we have discussed many poison and many smell, but see, ethanol has fruity smell. Ethanol has fruity smell. H2S has rotten egg smell. Ethanol has fruity smell. This, Dr. Sir, I think this question has come in this MCA exam. Yes or no? This was a question in your MCA exam. Let me see your answer. Okay, okay. Yes, yes. Ethanol has fruity smell. H2S has rotten egg smell. Para-aldehyde has acrid smell. Para-aldehyde has acrid smell. Nitrobenzene has shoe polish smell. तो सब मेरे साथ रिवाइज करना. Ethanol has fruity smell. H2S has rotten egg smell. Para-aldehyde has acrid smell. Nitrobenzene has shoe polish smell. Zinc phosphide has fishy smell. Hemlock has carrot-like smell. Ethanol fruity, H2S rotten egg, para-aldehyde acrid, nitrobenzene shoe polish. Doctor, this question I have seen in AIMS exam. Nitrobenzene has shoe polish. Zinc phosphide fishy. Hemlock has carrot-like smell. Doctor, hemlock, the botanical name of hemlock is Conium maculatum. Botanical name of hemlock is Conium maculatum. Conium maculatum. Rotten egg smell is present in H2S. Fishy smell in zinc phosphide. Acrid smell in para-aldehyde. Acrid smell in para-aldehyde. Okay. I think this rotten egg was a question in this exam. Sir, zinc mimic malaria. Zinc is the poisoning which mimic malaria. Zinc poisoning mimic malaria. And Dr. in zinc poisoning, we have fever which is known as smelter fever or zinc fume fever. We have fever which is known as smelter fever or zinc fume fever. Zinc fume fever. It mimics malaria. Now, Dr. route of administration. Route of administration. कौन कौन सी रूट से हम डालते हैं? Skin popping. If we are giving injection drug, that is skin popping. If we are giving lining, this is main lining IV injection. Smoking, chasing the dragon. Snorting, nasal inhalation. Chasing the dragon or smoking, it is another skin popping injection. Main lining IV. Smoking, if we smoke, this is chasing the dragon. And nasal inhalation is snorting. Nasal inhalation is snorting. What was your inhalation method that was given in option? Anyone? Begging. Which method was given? Anyone? Begging. Another method of inhalation, that is begging. Begging. Am I right? Begging. What is begging? Anyone? Begging is inhalation method. Begging is inhalation method by using plastic bag. By using plastic bag. By using plastic bag. If you use cloth piece and then you inhale, if you use cloth piece and then you inhale, what is this known as? Anyone? Cloth piece. Anyone? If you use cloth piece, then you inhale, this is known as huffing. If you use cloth piece, then you inhale, this is known as huffing. 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 So this is also a inhalation method. Plastic bag you are inhaling, that is begging. Yes, begging. Plastic bag inhalation is begging. Cloth piece you are smoking, that is known as huffing. Huffing. Okay, so these are some method. What is sniffing? Nasal directly. Nasal inhalation directly. Nasal inhalation directly, that is also known as sniffing. Jैसे sniffing. This is known as sniffing. This is known as sniffing. Nasal inhalation. तो डॉक्टर साहब आप तो ये याद रखो, हफ क्लोथ को बोलते हैं, बैग प्लास्टिक बैग को बोलते हैं, इसको स्निफ बोलते हैं. स्निफिंग. Sniffing. Sniffing. So Dr. Saab, main lining, IV lining, these are method. Main lining, IV lining, these are also methods. Okay. Okay. Difference between sniffing and snorting is slight different, but you just remember both are same almost. Sniffing and snorting, nasal inhalation. Sniffing we use sniffer, both are nasal inhalation. And there is one more word, I think, gliding, but आपके वो आता नहीं है इतना. Gliding. चलो बाद में लिखा दूंगा. जगह मिलेगी लास्ट में. Rave drug or party drugs. Rave drug or party drugs are ecstasy. Ecstasy is known as love drug or hug drug. Ecstasy is known as love drug or hug drug. Love drug or hug drug. Medico-legal document. Minimum time should be preserved for 10 years. Any medico-legal document, minimum time should be preserved for 10 years. Any medico-legal document, minimum time to be preserved for 10 years. 10 years. Body Packer syndrome. Ecstasy is a love drug or hug drug, party drug. Body Packer syndrome. What is Body Packer syndrome, sir? What is Body Packer syndrome? You swallow Body Packer syndrome. What you do? You swallow a drug in polythene and condom and you smuggle. This is known as Body Packer syndrome. You swallow a drug in polythene and condom and you smuggle from one place to another. This is known as Body Packer syndrome. And if you put the drug in your cavity, like ear cavity, vaginal cavity, or anal cavity, this is known as Body Stuffer syndrome. You swallow a drug in polythene in your body, then you smuggle in one place to another. This is Body Packer syndrome. Body Packer syndrome. If same drug in polythene and condom, you put in your cavity. Now, what are the cavity do you have? Cavity are ear cavity, vaginal cavity, and anal cavity. This is known as body stuffer syndrome. Body stuffer syndrome. Body stuffer. So we have two syndrome, body packer and body stuffer. Now, lie detection technique. Now, lie detection technique. Truth serum drug. Truth serum drug is scopolamine. This question comes in exam. Truth serum drug is scopolamine. Truth serum drug is scopolamine. Brain mapping is another lie detection technique. In this, we have a finding which is known as murmur. Brain mapping, we have a finding. This finding is known as murmur. Polygraph test, we detect few things. These are blood pressure. These are blood pressure, pulse, blood pressure, pulse, respiration, and skin and muscle movement. Blood pressure, pulse, respiration, skin and muscle movement. This is known as polygraph. Doctor Sahab, all these three are lie detection technique. This is best brain mapping. Brain mapping is the best technique. Truth serum drug is scopolamine. Brain mapping finding is murmur. Polygraph test, blood pressure, pulse, respiration, and skin movement are recorded after putting some question. Doctor Sahab, fatal dose of paracetamol. Paracetamol is acetylcysteine. 40 to 50 tablet of paracetamol is a fatal dose. 40 to 50 tablet are fatal dose of paracetamol. 40 to 50 tablets are fatal dose of paracetamol. So another method of inhalation I told you is glading. What is glading? Inhalation of air freshener aerosol. In this, sir, we inhale directly aerosol, air freshener aerosol directly. जो जैसे हम बोलते हैं ना, spray like inhalation. Air freshener aerosol directly inhale, that is known as glading. That is known inhalation of air freshener aerosol. Inhalation of, देखो डॉक्टर साहब मेरे साथ रिवाइज करना. If we use cloth piece for nasal inhalation, it is known as which method? Cloth piece. Cloth piece. क्लोथ पीस वाले को क्या बोलते हैं? हफिंग. प्लास्टिक बैग यूज करते हैं तो उसको क्या बोलते हैं? बैगिंग. एरोसोल डायरेक्टली इनहेल बाय एयर फ्रेशनर. एरोसोल बाय यूजिंग एयर फ्रेशनर. ग्लैडिंग. स्मोकिंग को बोलते हैं चेसिंग द ड्रैगन. स्मोकिंग इज चेसिंग द ड्रैगन. तो सब पहले मैंने गलती से शायद वहां पे नेजल इनहेलेशन को चेसिंग द ड्रैगन लिखा. स्मोकिंग इज चेसिंग द ड्रैगन. स्मोकिंग इज चेसिंग द ड्रैगन. Smoking is chasing the dragon. Snorting is nasal inhalation. Sniffer, same type of sniffing is there. IV injection is known as mainlining. IV injection is mainlining. Injection in skin is known as skin popping. Acrid smell, anyone? Acrid smell. Okay. Acrid smell in para-aldehyde, my dear friend. It is in para-aldehyde. Acrid smell in para-aldehyde. Acrid smell is para-aldehyde. Shoe polish smell. Shoe polish smell. Yes. Shoe polish smell. It is Nitrobenzene. Shoe polish smell is nitrobenzene. Okay. Hypocalcemia in which poison? Hypocalcemia. Which poison? Oxalic acid. Fishy smell. Fishy smell. Fishy smell. Yes. Fishy smell. Zinc phosphate. Rotten egg smell. Rotten egg smell. H2S. Rotten egg smell. H2S. And murmur is a finding of which light detection technique? Murmur is a finding of which light detection technique? Yes. Brain mapping. Truth serum drug. Truth serum drug. Scopolamine. Truth serum drug is scopolamine. Scopolamine. Rotten, sorry, carrot-like smell. Carrot-like smell. Yes. It is hemlock. Conium maculatum. Smelter fever is caused by. Smelter fever is caused by. Yes. Zinc poisoning. Zinc poisoning. Zinc phosphide. Zinc poisoning. Fishy smell. Fishy smell. Yes. Zinc. Fishy smell. Zinc. Okay. Medico-legal document should be preserved minimum for how many years? Minimum for how many years? 10 years. Medico-legal document should be preserved for how many? Minimum for 10 years. 1 decade. Most common plant used for vitriolas. Most common plant used for vitriolas. Now I will show you some remaining pictures, okay, which are left. I think we have discussed every part. So this is Hadruff formula. This is V+ injury. I have already told you V+ injury is hyperextension injury. V+ injury is hyperextension injury. Yes, we have discussed all these images. This is crucifixion. Here we have positional asphyxia. I told you. Positional asphyxia. This is jackknife position. Again, trachea gets compressed. It's a positional asphyxia. This is yellow oleander, cerebra, yellow oleander. This is white oleander, nerium. This is Ratti. As I told you, Ratti are red seed. Ratti are red seed. It is known as liquorice. This is Datura. 100 seed are fatal dose. Semicarpus anacardium, which is known as marking nut. Semicarpus anacardium, which is known as marking nut. It is used for vitriolas also. This is a polygraph test, a lie detection technique. This is strychnine. So this question is also comes in exam. Nux vomica, brown seed. One seed is a fatal dose. This is known as Nux vomica. Nux vomica. It is known as Nux vomica. Next. This we have seen, Dr. He is a father of DNA fingerprinting, Alec Jeffrey. Father of DNA fingerprinting. This is known as Alec Jeffrey. Forensic entomology. Russell viper, very common. You can see this is triangular shape viper. This is known as Russell viper. Head. Davidson body seen in female. Fingerprint, I already told you. Mugging. Washerwoman hand. Now tell me anyone. Washerwoman hand is seen in antemortem drowning or postmortem drowning? Antemortem drowning or postmortem drowning? Washerwoman hand. Antemortem or postmortem? Both. Yes, Damodaran. Absolutely right. It is both. Both. This is garroting. This is smothering. This is crocodile. This is subdural hematoma. This is subdural hematoma. Tardive spot, Takenoir, custard seed. I told you fatal dose of custard seed is 10 seeds. Practice. This is laceration splitting. This is punctured, that is stab wound. This is penetrating trauma. As I told you, most common organ injured in penetrating trauma is liver. Cobra. This is Orfilla, father of toxicology. Orfilla, father of toxicology. This is saw scale viper. Again, you can see this is triangular head. This is phosphorus burn. It is used as Diwali poison. The white phosphorus. White phosphorus. This is activated charcoal. This is a activated charcoal physical or mechanical antidote. Arsenic induced hyperkeratosis of palm. Burtonian line. These are blue line on gums seen in lead poisoning. Everything we discussed. This is carrot, common carrot, banded carrot. This is blister beetle. It causes cantharide poisoning. This is blister beetle. It causes cantharide poisoning. This is Calotropis acro or madar. Calotropis. This is rat snake, non-poisonous snake. This is mercury poisoning causing Minamata disease in Japan. This is a valve tube used for gastric lavage. Poppy fruit, by which we take opium out. And I told you vertical incisions are given. Vertical incisions are given. Sea snake, which is a myotoxic snake. This is a pilocarpine antidote. It is also known as jaborendi. Pilocarpine is antidote, which is also known as jaborendi. Heroin. This is heroin type. It is also known as brown sugar. Brown sugar. Mesaline present in arsenic poisoning. Mesaline present in arsenic poisoning. Datura stramonium, I told you. Thorn apple. Datura stramonium. It is also known as thorn apple. This is Datura alba. This is Claviceps purpura. This causes ergot poisoning. Ergot poisoning. Ergot poisoning leads inflammation of palm and sole. Ergot poisoning leads inflammation of palm and sole. Inflammation of palm and sole. Inflammation of palm and sole. This is ergot poisoning. Inflammation of palm and sole. Doctor Saab, this is all about forensic medicine and toxicology.
सर डस्टिंग और ग्लेडिंग में क्या डिफरेंस है सर?
फोटो देखी दोनों की?
हाँ जी
क्या फर्क लगा तेरे को?
सर, जो आपने लिखवाई थी ना अभी डेफिनेशन, वो एक्चुअली
मैंने तो
डस्टिंग की
फोटो
लिखी
दिखाई ही
हुई है।
नहीं। तूने कभी फोटो देखी डस्टिंग और ग्लेडिंग की?
सर मैंने डेफिनेशन पढ़ी थी।
क्या पढ़ी? डस्टिंग क्या होता है? उसमें क्या करते हैं, स्प्रे करते हैं नाक में और मुंह में, स्प्रेइंग इन द नोज एंड माउथ।
हाँ जी।
और उसमें क्या करते हैं, ग्लेडिंग में एयर फ्रेशनर से आप डालते हो एरोसोल।
एरोसोल
ठीक है?
फर्स्ट स्प्रे
एयर
इन
फ्रेश,
रूम एंड देन जी।
देखो डस्टिंग का मतलब है स्प्रे। देख इसको दे, इसको बोलते हैं डस्टिंग। और एयर फ्रेशनर को आप सीधा एरोसोल से अपने नाक में डालते हो। इफ यू आर पुटिंग एयर फ्रेशनर इन एरोसोल, दैट इज नॉन एज ग्लेडिंग। ग्लेडिंग,
ओके सर।
ओके। और स्प्रेइंग इन माउथ एंड नोज इज नॉन एज डस्टिंग। स्प्रेइंग इन माउथ
ठीक
एंड
है
नोज,
सर।
समझ में आया मेरी बात?
जी सर जी।
ओके। स्प्रेइंग इन, लिख ले, स्प्रेइंग इन माउथ एंड नोज इज नॉन एज डस्टिंग।
ओके सर, थैंक यू।
यस।
सर और जो आपने इंडिकेशंस बताए थे ना उसके एमटीपी के, वो इस बार क्वेश्चन आया था और आई थिंक जो आपने लिखवाए थे वो 4 ऑप्शन थे।
क्या क्या क्वेश्चन क्या था? व्हाट वाज द क्वेश्चन?
व्हाट इज द इंडिकेशंस ऑफ एमटीपी?
हाँ तो सही है ना, चारों ही थे फिर, चारों ऑल ऑफ द अबव होगा ऑप्शन फिर तो।
नहीं नहीं, अच्छा एक्सेप्ट था।
गच्चा गा गया छोरा है।
बट सर यही ऑप्शन थे चारों ही, फिर एक्सेप्ट कैसे होगा?
नहीं ये नहीं हो सकता, ध्यान से पढ़ना उसको, क्वेश्चन को। ऐसे कैसे हो सकता है?
ठीक
तो
है
फिर
सर।
ना वो ध्यान से मेरे को भेज।
ठीक है सर।
आपको लगभग मैंने 20 से 22 घंटे की फोरेंसिक पढ़ाई है। कितनी पढ़ाई है दोस्तों? चलो आप सब फीडबैक भेज देना। गुड बाय, गुड नाइट, आराम से अच्छी तरीके से तैयारी करो, फिर आगे वाली क्लासेस में मिलते हैं। ओके बाय।